So you have studied Ayurvedic medicine and these years take a major part of your life. Once you become a doctor, you are committed to healing. And to be a great healer, learning has to become a never-ending pursuit in your life. So doctor, what are you doing to continue this learning?
A very warm welcome to all the doctors, students and practitioners for this RASAAYANAM.
Learning experience for everybody, even for me also, isn't it? So there is no end for learning. So that's what actually I believe.
Today's subject you are given is psoriasis.
Clinical dermatology.
If you use Vamana on yourself first, then you will believe that it will help.
Spending few hours with a scholar is equivalent to months of time spent reading books. In the name of AACHAARA RASAAYANAM, we are bringing excellent minds on Ayurveda with rich expertise in clinical practice. The purpose of this initiative is to guide and uplift the confidence and clinical expertise of every Vaidya. There is a saying, if you cannot be a king, the next best thing is to become a healer, because you are changing people's life, and that is the power of a Vaidya. AACHAARA RASAAYANAM is a Ayurvedic practitioners only CME program initiated by Sitaram Ayurveda's 100th year celebration through Sitaram Research Foundation. Sitaram started its healing journey in the year of 1921. Being a pioneer in Ayurveda, Sitaram extends the healing powers through a state-of-art GMP certified manufacturing plant, government approved R&D laboratory, super specialty Ayurveda hospital, and an NABH accredited Panchakarma retreat. By attending AACHAARA RASAAYANAM, you will get the opportunity to get valuable insights on clinical practices, various methods and techniques prevalent in the Ayurvedic medical fraternity from the best scholars. You will be receiving the show notes, certificates, webinar recordings, and the latest updates on your email and WhatsApp. To receive latest updates and newsletters, please send a text to 89434 41881. For more details, log on to our website www.sitaramayurveda.com. AACHAARA RASAAYANAM. Great practitioners invest in learning.
A very warm welcome to all of you to AACHAARA RASAAYANAM, a weekly webinar series by Sitaram Ayurveda. This was initiated as a part of our 100th year celebration. And every Sunday, we bring in an expert and experience and share their wisdom on clinical practice. So today we have Dr. Shine Mohan, who is the Managing Director and the Chief Physician of Talapully Ayurveda from Palakkad. As far as I know about Dr. Shine, more will be introduced by Dr. S.P. Sreejit. As far as I know about Dr. Shine, he has invested a lot of his time, energy, and money to learn from a lot of various experts, not just from Ayurveda, Marma therapy, but also from many experienced, well-known, globally renowned osteopaths and chiropractors. Now, what we have to learn from these alternative modalities, when it comes to the pain management with musculoskeletal disorders, we can offer a lot along with our Ayurveda therapies like with Lepam, with Dara, with Karuthavattu, Marma Gulika, and also our ability to treat Shofa and also with our pain that is associated with edemas. This is just fantastic when we club it with Ayurveda. So, Dr. Shine, thank you so much for being part of AACHAARA RASAAYANAM. We are looking forward to listen to all your clinical expertise. So, thank you so much on behalf of Sitaram Ayurveda. And Dr. Sreejit SP sir, thank you for accepting to moderate today's session. So, we look forward to, and I hand over the baton to you. Thank you.
Yes, namaskar to all of you. I think we are at the right time and the right times also, because integration is the need of the hour, be it any system, not only just the musculoskeletal. So the peculiarity about Dr. Shine is that we are in many common groups. I found his enthusiasm to propagate the idea of acute pain management. That is a very daring and very relevant topic that he opted to get into. And the heritage of 4 generations of Ayurveda is definitely a great blessing for him, and he's taking those to greater heights. And even though we are discussing about osteopathy, we all know the relevance of cupping, of trigger point. Already we are very aware of that. And more importantly, we have realized how the game changer, if I use that word, how the confidence builder measures come in so handy to not only impress and relieve from pain a patient, but also for the patient retention, which is also very important in these days and times of doctors shopping, if that word can be politely used. Apart from this, what I have found in him, the enthusiasm is to train doctors as much he can, and he has done that for more than 200 doctors through various seminars those days and times till 1.5 years ago, and all those offline trainings. I have also joined that to learn more, whatever I could learn in one such what I would call as workshop and not seminar. And the impact is really great. And he's very transparent and very thorough and very upright with what he has to teach. So, apart from being an example himself and taking this to different levels and heights, he has been relentlessly pursuing the idea of integrating these different practices, be it marma, or you call it trigger point, or you call it cupping, or you call it myofascial stretch. All those are so related. And he, of course, doesn't forget the role of shobha, ama, the idea of langhana, the idea of snehapana later on, the idea of kiri if the need be so. So I have found him very unconventional compared to the normal academy background that many of us may come from. And with utmost respect to the academy, no doubts they're doing great tasks, but there's some homework that people like Dr. Shine are doing. And he's doing with a very clear passion, enthusiasm, and clarity. He has a purpose for the community, he lives it, and he loves it. So that I think really makes Dr. Shine. Did I introduce you enough and sufficient? I don't want a avyapti if no that happens. That is a cardinal sin I will end up in if I speak less of you than what you deserve. And kindly step in to add more about you. The faculty introduction is typically meant to be what we say intelligence report based. Since I see you black and white, left, right, center, everywhere in common groups, so I don't need a specific intel information as I need for some faculties. So that is one thing. So because you see, it's not about glorifying you or praising about you. It's all about communicating to others that no youngsters can step in, they can upgrade their level of no professionalism, they can embark into uncharted territories, and they can set examples as you are setting. And that is why I was so persistent about having you in this webinar, because 15 different states of candidates are here, and already we have 400 20 plus people who have registered. So, and of course more recordings would be watched. So for all these reasons, kindly feel very free to tell points that you think youngsters and even seniors should know about. Very, very important. But I think at least now I would let you start the process, other than adding that this cupping therapy is a kind of shodhana in one sense of it. The trigger points are somewhat like the marma manipulation, if I call it that way. But you have made a judicious mix of what is called the western and what is perhaps the eastern side of the knowledge and experience, and you have traveled length and breadth. I also know how you were in the company of my very dear friends and seniors to go for acupuncture. You went up to Assam, you learned from Shastri sir, and of course such Herculean task has been taken to you, and what you do is you are making a simple Sara Bhaga and very kind of the Hridaya Bhaga of that, and with that essence you are blessing the community that you are treating. And I see you enthusiasm. You had shared last time of an acute abdomen pain with cupping, and that was a dry cupping. It's not even a wet cupping to say so. And I also see that I won't say you are rebel, but no, you speak your heart out. And if it's in your heart, it's in your face, and that's in your mouth, and that's it. So I have also seen your enthusiasm when the the anti-Ayush gang of the famous hepatologist. No, let us not even use his name. It's not worth being used his name here. So I use the word famous hepatologist was making all nonsense. The Ayush Commando brigade that you had set up with Dr. Ranjit in Manar, Dhanvantari Hospital SDM, and yourself, and of course Dr. Binoy Bhaskar of Nangil College, and the list is long. And apologize me for not naming the entire long list, but so that's also a good thing that I think our youngsters can learn, and not just your clinical experience, which is of course worth imbibing and learning. So that is how I would say that. Thank you for being my partner in the Ayush kind of entities that we believe and we practice. Dr. Vignesh, myself, yourself, and many other so-called youngsters. We do our best to say that you don't can remain satisfied with Shastra only. You need Shastra also. Shastra is not just the parasurgicals or the methods that are followed, instruments, but it's also about the assertiveness and the strength that we exhibit for what we have, and not be meek when your science is publicly raped and murdered, just as Charaka Samhita was being raped and murdered. I am very particular and very serious of the word I am using. So thank you for being part of that moment where you stood up for the science and not just remained as an intellectual or a clinician, which is nice also in one way or the other. So I think, is it less? Let me know, or else we get into business right away. I mean, business means study, of course, right? Right. So anyway, I always feel quite elated and very happy that I can be the moderator for people I admire, which you are. And so I think, Dr. Vignesh, we get into action now. It's 10:41, 10 minutes have passed. I think the audience is more than ready. And I think, Doctor, whenever you have any challenge, maybe around 1 hour from now, you can have a 3 minutes break or 5 minutes break. We will request Dr. Rahul to step in instead of Dr. Ragesh Chiran sir today. So Dr. Rahul will step in. So so kindly, I mean, of course, you can complete the topic that you will be involved into. But if Dr. Rahul interferes, if I use that word, to take over for 5 minutes, kindly, that is part of the official semi break. And I want to let the audience know very clearly that within 5 minutes we'll give enough rest to the faculty and get back to you, so nobody is missing anything. Then everything is there. So let us get into action. Yeah. So all yours now. Yeah. I go off the video and the audio. Yeah, all yours.
Thank you so much. It feels very humble, and to get an introduction like that from someone you've admired, and with the work that Sreejit sir does, and it's really a blessing. And thank you so much, Sitaram Foundation, for giving this opportunity, because I think like right from when I started my little journey of exploring other things and sharing my knowledge, and it was not. Sometimes it was not well received within many people in the community, especially because it was something new, and we didn't. It was like a pretty unconventional, just different from the regular norm. So I've had a lot of people questioning it, a lot of people ridiculing it, but then in the end, it's just the kind of experience that I get in my clinical practice, the kind of experience the doctors who have trained have actually give back their experience, and actually it is those things that actually keeps me going on, and I'm very happy. And this is a big stage, and I congratulate Sitaram Foundation for the work they've been doing, and on their centenary celebrations as well, to come out with a series of workshop, and for reference for doctors, for budding doctors, and refresher for many senior doctors as well. So it's a great thing to do for the community as a whole. So I think let's go to our topic without any delay. So today my main aim is to give you all an introduction into the field of osteopathy, because what we have been treating patients, since as long as I wear, as long as there's human. So, and we have been doing osteopathy without actually calling osteopathy, and that's why I think it is important that we understand these concepts, and we understand what is there, the latest research that is there offering for us, and we imbibe it, because it helps us to understand our science more better. So he said that I always begin my workshops by paying my humble prayers and my ancestors. This is my great grandfather, Sri Talapully Krishna Vaidya. He was born about 50 years before he died about 50 years before I was born. And it's always you get these feelings, it's really humbling, and I feel very honored and privileged, and this is where I start. So this is as you see, this picture is the picture of a person about 85, 87 years old, and what you see in his ear is a mark, right? So he's a very respected person in our village, and he came to me for a back pain about 3 or 4 years back, and that's when he was sharing a story that when he was a very small child, about 4 to 5 years old, he had come to my great grandfather for an acute colic pain. That's what he remembers. And my great grandfather, he used to do Agni Karma Shalaka, Agni Karma a lot. And he remembers that he doing Agni Karma on the apex of the year for a condition like this, right? So this actually got me thinking, and this was really a great, boost for me, and I was like surprised to see. And then I went and learned about different kind of things, and that's why I know I kind of have an answer for everything now. This is my grandfather, Sri Talapully Ramankutti Vaidya. He was also a very famous practitioner in his times, and a lot of Vaidyas came to our house and studied in Gurukula system. And this is my grandfather's brother, Dr. T.K. Oni. After having his formal education in Ayurveda, he went on to do an MBBS. He retired as a district medical officer, and he was the first one to do vasectomy in our district. So, and more patients, elderly patients who come to us or come to me, tell me stories about how great my, the former ancestors and all were. So it's an honor, and I feel really humble that, I'm proud that I can present them before you. So for the topic now, what is osteopathy? It is based on the principle that well-being of an individual depends on the skeleton, muscles, ligaments, and connective tissues functioning smoothly together. Now, we all talk about holistic, treatment. And what is holistic? So it is this connection what body and mind has, with this musculoskeletal system, how it affects the organs, and osteopathy basically deals with that. Philosophies and principles of osteopathy. Every human is a unit of body, mind, and soul. Sorry for the spelling mistake. The human body is a whole integrated organisms in which all parts function independently, right? It is an integrated organism. It has every part has its own function on purpose, but then collectively they all combine to perform together. The body has its own self-regulatory mechanisms and is capable of self-healing and health maintenance. And this is something that we all need to keep remembering or keep teaching ourselves, that there is a self-regulatory mechanism, and whatever we are doing with procedures or even with medicines, we are actually helping the body to heal itself and to create. And that's basically, we are bringing the vitiated doshas to the normal self. So a well-being of a person depends on the proper smooth functioning of all structures in the body, including bones, muscles, tendons, ligaments, and organs. So simple, straightforward explanation. And so a little bit on the history about manipulations and mobilizations. Now, what sometimes people, there's so much thing in the internet, and so many chiropractors and practitioners and osteopathy thrust techniques. You have Kalari, all claiming to perform miracles. And what we need to understand is that every treatment has its own merits, its own demerits, and it is all subjective, right? So when we talk about manipulations, or we will talk more about that in future. What is manipulation and what is mobilization? These are different techniques that we actually help to ease the joint and to increase the function of that particular moment. So it has been there in many cultures, throughout the world, and we all know that. And Kalari and Marma specialists have been doing it in Kerala and Tamil Nadu till date, and they've been doing it even till date. So, and this was something very subjective. Subjective in the sense, it varies according to individuals. It varies according to conditions. It is not something that can be, what do you say? It's not something that can be fixed. You cannot have a fixed. And that's why the importance of yukti comes into play. The importance of being updated comes into play. The importance of understanding, all these different kind of systems and when to use and where to use actually comes into play. So I don't really claim that, everybody should stop whatever you're doing and come, let's all do osteopathy. That's not my intention. Like Dr. Sreejit had already said, and, it's all about integrating it. And it's all about being aware of these different techniques that are available and judiciously integrating it into your practice according to the need of the condition or according to the need of the patient. That's where the real the trick lies. In Europe, Hippocrates was the first physician to describe manipulative techniques. It was there, it is continuously been doing it, and it was in the 1800s. In the mid 1800s, when Dr. Andrew Taylor Still, the founder of osteopathy, first introduced manipulation as means to treat a variety of conditions. So Dr. Andrew Taylor Still is known as the father of osteopathy, and there is a very famous picture that I always share even in the workshop. So apparently this is please excuse me for a moment. I just got something. I'm very sorry about that. I hope I'll continue. So that picture is about Andrew Taylor Still. When he was a young boy, he was the son of a farmer. He used to accompany his father in the field, and he used to get this headache, right? And whenever he was getting this headache, and what he used to do, he tried to. You can just see the picture. He tried to, keep his head, like he was just trying to lie down, and keeping his head in a rope, right? And what he was trying to do, he was just trying to feel that, relieve that headache. So he'd put a blanket on the rope, and then he was putting his head, right here. So, and and he used to do this every year. Every time he had a headache, he practiced it, and somehow he felt there is a great relief, right? So I'm just going to read it out. So one day when about 10 years old, I suffered from headache. I made a swing out of my father's plow line between two trees, but my head hurt too much to make swinging comfortable. So I let the rope down for about 8 to 10 inches off the ground. So about 8 to 10 inches off the ground, he put a rope and threw an end of a blanket on it. And I lay down on the ground and used the rope for a swinging pillow. Thus I lay stretched on my back and neck across the rope. Soon I became easy and went to sleep. Got up in a little while with headache all gone. As I knew nothing of anatomy, I took no thought of how a rope could stop headache and a sick stomach which accompanied it. So please understand what he said. So he also had a headache, and every time he got this headache, he had a sick stomach as well. But when he did this technique or trick that he, just by accident, or and he felt relief for both. So after that, I rope my neck whenever I felt those spells coming on. I followed that treatment for 20 years before the wedge of reasons reached my brain. I could see that I had suspended the action of the great occipital nerves and given harmony to the flow of the arterial blood to and through the veins, and ease was the effect, as the reader can see. So later, when he became, when he studied medicine, and that's when he realized that he had actually suspended the action of the great occipital nerves by using that compression. So and it was his studies and his that actually started developing into what is called as osteopathy. And his famous quote that actually hit me very hard, and knowledge of anatomy is only a dead weight if you do not know how to apply that skill with successful skill. So every graduate or people, even I was, I left my anatomy books after my first year. I didn't bother to really study anything after that. And it was later when I started exploring these techniques, and I understood the importance of anatomy and understanding them. And this very quote actually really hits you. It hits your ego, because we study it and we just keep it shut. We don't really use it. And thorough knowledge about muscles and its action is absolutely essential for treating musculoskeletal conditions. Now, and this is something that even I felt like, in my earlier practice, it was always about terminologies and diagnosing it in terms of Ayurveda, like, Kadigraha, all the different names that we actually give for, conditions. And then you have these coming into clinics, and without understanding the structures, without understanding the thing, it's a norm that we used to treat it generally, like the common thing would be like, Abhyanga, Snehana, Swedana, Vasti, etc. And sometimes you get good results, yes, with a continuous rest of about 10 to 14 days in the clinic. And sometimes, most of the cases you get good results. But it's something challenging is when people come back after the session, when they actually take rest, the 14-day treatment is over, 14 days, the recovery period is over, and they start getting back to their normal routine. They sometimes talk about relapse of these symptoms and pain, and that's when they come to us. And we have seen a lot of conditions like that. So it's basically about understanding the complete musculoskeletal system, how it works, and then applying our principles, based on that. And that I felt is always very helpful. And when you talk about musculoskeletal systems, the very basis of everything that you deal in a muscle, I think trigger points, the knowledge about trigger points is essential to effectively treat the different conditions of the muscles, right? So one thing, so along this, workshop, this is just 1.5 hour, I'll be sharing few points. You can actually take a note of, keep a pen and paper handy. You can just note like this. These are like your goals or your targets that you should probably learn and read about. So the number one thing that you should all begin with, those are already practicing, please excuse those who are not practicing. Number one thing you should explore is trigger point therapy. What is a trigger point? How it works, how do you identify them, and how you treat them. This begins. This is the basic thing that we have to all start doing it. And lot of online things are available on the internet. A lot of YouTube videos are available. All you have to do is just start searching, and that is exactly where I also began when I first heard the name trigger point. I went online, I searched, and then one thing led to another, and that's how I get all these. Your interest develop, and once you learn something, trigger points, then you kind of become so engulfed in it, and then next thing which is associated, it comes to your mind, and then you go, and then it's a continuous learning process. So everyone, number one is what you have to do is learn and read about trigger points, right? So, and there's a study in 2010 and 1990 which says that trigger point is present everywhere, and it affects as much as 85% of the population at some time in their life. So this is a phenomena that is there, present in the body. So as doctors and as practitioners, since we are treating the human body, it is equally important that we understand what it is. Otherwise, we are missing it out on a, in a big thing. And with the COVID situation, with people sitting inside their houses, with everybody converting their house office, their house into office rooms, they're not really following the proper ergonomics. They're not using proper chairs. They're not using proper tables like how they would have in their offices. All are sitting in their homes, and and you see there is a big rise in the musculoskeletal conditions, in the last 10 years, and especially in the last 2 years, it is on even a higher level. And with the COVID, and with a lot of us sitting inside our house, and doing, even for this webinar, for example, this wouldn't have happened without COVID. 2 years down the line, probably we would be having the same thing as an offline workshop with doctors, and I'll be probably standing and taking class, but now I'm sitting and doing it. So there's a lot of difference with the kind of postures that everybody has been doing, and we have and usage of computers, which was only for the engineers or the accountants, but now it's for everyone. Everybody are using computers, right? From school students, college students, teachers, everybody are sitting in front of this screen, and that makes it more important for us to learn what is happening. All these terms like trigger points and myofascial pain syndrome, etc. So it is present in babies and children as well. The impact of myofascial pain on health can be severe, as patients do not suffer from pain and loss of function, but also from impaired mood and decreased quality of life. There's a study in 2013 by Gerber. So, and this is clearly what we talk about. Even though the samadosha and samagni is there, but then the only prasanna atmendriya mana won't be there. So this is what happens. When people come to you with investigation reports which says everybody is normal, the blood reports is normal, the MRI is normal, the X-rays is normal, and they come to us and telling, doctor, all my reports are normal, but then I can't get up in the morning, I can't get up from my bed, I can't do my regular duties that I've been performing so long, and what is stopping me? And that's the thing about these myofascial pain, or what we call these trigger point pain, or these musculoskeletal conditions that we see today. And majority of these cases are often misdiagnosed, and even sad to say that some unwanted surgeries, etc., are happening for simple musculoskeletal conditions. So even people right after surgery, they come back and they still not heal from their condition. So anyone who touches the body should have a thorough and deep knowledge of trigger points, definitely, because that is a phenomena that is present in the body. And as Ayurvedic doctors, or in Kerala, we talk about the small lumps and knots, and kattippu, tadippu, and we have a huge controversy of whether we should massage it hard, we should do it slow. And then I remember reading a book. I think it was one of these health magazines in like Arogya Masuka, and the feature was about massages, and the one of the person, he was representing he's from a very famous Ayurvedic institute, and I think he was a senior therapist or someone, and he was talking about an Ayurvedic massage, and he says that Ayurvedic massage is done usually with our fingers closed, and it's done in a very in a rhythmic fashion, and this and that, and that actually I have a lot of thing against it, because when there is a issue, deeper muscle or a deep tissue issue is there, then you are required to do a deep tissue massage, or you are address that deep tissue, because you have to address the proper condition, right? So just by doing a vague massage or in a superficial effleurage, you don't actually treat it, and you cannot depend everything on like a vasti or a kati vasti or something like a kiri, because it is evident what is the symptom. If somebody is having a back pain, we assess it. How does he get the back pain? If he's doing a long, if he's having a standing job, and if he's getting a back pain because of his standing, if he's getting a back pain because of lifting things, if he's getting a back pain due to continuous sitting, and what are the restricted movements that he has when he comes for a back pain, and we have different conditions. You have people coming to you saying that, doctor, I can stand, I don't have a back pain, but I can't sit. I have a back pain while sitting. Some people tell you that I'm okay while sitting, but as I stand up, I'm having a back pain, right? When he lies down, the back pain increases. When he walks, the back pain is not there, right? And when he lies down, sometimes he gets a relief, and sometimes when he walks, he gets back pain. So it's these different things. Everything comes under back pain. So you cannot club everything as like a katigraha, or you cannot fix a treatment modality or everything like Abhyanga plus PPS plus Tairadhara plus Vasti, and hope to achieve a miracle, right? So it's always better, we understand what the exact pathology is, we understand what muscle is affected, because when we are addressing musculoskeletal conditions, we have to understand which muscle is being affected and how we should treat it, right? So, this whole thing about trigger points and myofascial, it all began with, Dr. Janet Travell and David Simmons. And there's a very interesting book called, a book by Travell and Simmons, it's called, right? And, we all know that, President John F. Kennedy, according to his mother, the former president of America, he nearly died of scarlet fever at 2 years. He had whooping cough at 5 years, digestive problem at 14 years, hypothyroidism at 17 years, and after a spinal accident at about 30 years, he almost completely bedridden. And this was after he became a president, and when he was completely bedridden, Dr. Janet Travell treated him. And she applied the principle of trigger points and the pain map associated with it. So you can see this was the pain map suggested by Dr. Janet Travell. So see, this was a condition, the erector spinae muscles was affected, the gluteus maximus, minimus, and medius of both sides. You have the tensor fasciae latae on both sides, and gastrocnemius on both sides. So all these muscles were affected, and she actually treated him with, the principle of trigger points. And after he became a president, he actually appointed her as a personal, physician. And it usually, it's very strict in America that, a president really don't get to choose all this. But then when he became president, he did that. So what are trigger points, right? As in definition, a highly irritable localized spot of explicit tenderness in a nodule in a palpable taut band of a muscle. The name was coined by Dr. Janet Travell and David Simmons, right? So I think the easiest way that you can all, check for a trigger point is probably, I want everyone to actually just take your hands and feel, just kind of press this area. I hope all are doing it because I can only see my screen, right? And if you can feel that lump or a knot there, right here, just this is your collar, just about 1.5 inch, lateral to that, probably just about the mid-clavicular area, where the trapezius muscle comes in. And this thing is the most common trigger point that you see in everybody, because we do sitting jobs, we do a lot of writing prescriptions, we do a lot of things, and we don't really make it a point to actually do stretches or really. Not everybody are into exercises and stretching, and all these comes as little add-ons, and which later actually what happens is gives to stiffness and muscle spasms. And I'm sure this is one of 99% of the time when somebody comes with a shoulder pain or a neck pain or headache, and when you search this point, this is all very stiff and hard, right? So myofascial trigger points are those trigger points that are found in a specific muscle and its facial mapping. So you have the muscle fiber, you have the entire muscle fiber, and the contraction of the muscle fiber, and what happens is the muscle fibers contract and they stick together, and then leading to a trigger point. And without treating it, what happens, the subsequent muscle fibers are also affected, and thereby the entire muscle becomes stiff, right? So there's a small video. It is available online, in the YouTube. I'll just play it.
Many people suffer from pain and physical problems. Very few people know that these problems are often related to trigger points. Understanding and treating trigger points helps to lessen pain and improve overall health.
Yes, doctor, we can
This
hear it well.
is a short explanation and introduction to the trigger point. A trigger point is a Many people suffer from pain and physical problems. Very few people know that these problems are often related to trigger points. Understanding and treating trigger points helps to lessen pain and improve overall health. This video is a short explanation and introduction to the trigger point. A trigger point is a small muscle contraction which can be felt as a small nodule. Pushing on this nodule is very painful. Trigger points can exist in each muscle of the body. Multiple can exist at the same time. Often both sides of the body are affected equally. The trigger point keeps the muscle tight and weak, restricting the muscle's range of motion. A trigger point can actively cause pain, or it can cause no pain unless touched. Mostly this pain is sent to a different area of the body. This is called referred pain. Referred pain can make finding and treating trigger points difficult. Luckily, referred pain follows typical patterns that have been well documented. Let's take a closer look at the trigger point. A trigger point lies in a taut band. The taut band is a tight strand of muscle that feels like a cord, easily mistaken for a tendon. The trigger point itself can be felt with the fingertips when its location is superficial. The size varies from a pinhead to a pea. When we continue to zoom in, we can see the muscle fibers that make up the muscle. The lines on the muscle fibers represent sarcomeres. Millions of sarcomeres, acting like tiny pumps, have to contract to create movement. Sarcomeres can become overstimulated and unable to release their contracted state. This knot of contracted sarcomeres shows a segment of the fiber that has become shorter and wider because of this. But also a different segment now becomes stretched by this tension, shown by the greater distance between the sarcomeres. Together, multiple of these sarcomere knots form the trigger point. The stretched segments of the fibers give tightness to the taut band in which the trigger point lies. When sarcomeres are stuck in contraction, blood flow stops in the immediate area. The resulting oxygen starvation and accumulation of waste products irritate the trigger point. The trigger point responds by sending out pain signals. In return, your brain will stimulate you to stop using the muscle, which further shortens and tightens up the muscle. Trigger points will not release without proper treatment. The most effective way to treat a trigger point is applying deep stroking massage directly to the trigger point. This can be done without the help of others. Deep stroking massage means performing a series of deep strokes across the trigger point nodule. In this example, a rubber bouncing ball is placed between the body and the wall to reach the trigger point in the lower trapezius on the back side of the body. You can see the ball moving slowly and deeply in short strokes from one side of the trigger point to the other. Series typically consist of about 8 to 12 strokes and are performed about 5 to 10 times a day. By using deep stroking massage, you are milking the trigger point, so to speak. Blood and lymph fluid is moved out containing waste generated by the contracted muscle fibers. Each time you move over the trigger point and release the pressure, fresh blood immediately flows in, bringing fresh oxygen and nutrients. It may take several weeks to return the muscle fibers to their normal state and fully release the trigger point. Trigger points which have existed for a long time will take a lot of treatment, but often results can be achieved in days, meaning less pain and improved mobility. You can find references to more in-depth information about trigger points and their treatment in the video description below.
I hope everybody was able to see that video. It's a very simple, video, great animation video. You can just go online and you can actually see it. So I'll just give you a small, example of how we actually treat, let's talk about a quick refresher on the few muscles. Trapezius, it's the muscles on the posterior, like the superficial most posterior in the back. right? The origin from the medial third of superior nuchal line of the occipital bone, external occipital protuberance, and the ligamentum nuchae. This is where the, the trapezius origins, right? And the spinous process and supraspinal ligament of the seventh cervical and all the thoracic vertebrae to T12. Here's how the trapezius originates, right? It inserts in the posterior border of the lateral third of the clavicle, medial border of the acromion, upper border, crest of the spine, and scapula and tubercle on the crest. So when we talk about trigger points, you see these blue dots are called the trigger points, right? And in this picture, what you see here is the what you can see here is the pain map, right? So the trigger point is here, but this is the pain map, and that is the most interesting phenomena or thing about trigger points. The trigger point is formed here, and see neck pain. He's also having a headache, frontal headache, and you can also see a slight pain towards his jaw, right? And you have people coming like this, and so very interestingly, and what I always felt that whenever we search for these trigger points and when we apply pressure, you can actually give back the same symptoms that the patient is, reproduce the same symptoms that the patient is complaining of, and that I felt gives you a great connect to a patient. And a patient comes with a headache, right? Like a frontal headache, or and then you do all the lay pass and things like that. But then when I do a trigger point therapy, I search for a trigger point and I press, and I reproduce that pain. And that's when the patient tells you that, sir, that is the exact pain that I have. And that the kind of thing, it helps the the psyche of the patient, and he feels that whatever happens, this doctor has found something which is related to my pain, and then I'm sure he's definitely going to treat it. And that's how it actually boosts your confidence as a practitioner, and also boosts the confidence of a patient, thinking that yes, my issue has been addressed properly, right? So when we talk about trigger points or any muscles, we need to understand the action of the muscles is also very important, right? The trapezius muscle, the upper fibers pull the shoulder girdle up, helps prevent depression of the shoulder girdle when a weight is carried on shoulder or in hand. Middle fibers retract scapula, and the lower fibers depress scapula, particularly against resistance, as when using hands to get up from a chair. So the upper and lower fibers together rotate scapula as an elevating arm above head. The antagonist is the serratus anterior. So when somebody has a restriction of let's say a stiffness in the trapezius muscle, right, this also prevents the abduction of the hand. That is something that we need to remember. So because of, we need to understand and we need to refresh the principle of agonist, antagonist, and synergist, and that is exactly how we should go about treating a joint, right? Everybody who cannot lift their hands cannot be treated as upper bahukam. It should not be treated as frozen shoulder. It should be classified as to every joint, like the method is classifying under, is it a muscle or ligament related issue, or is it a tendon related issue? Is it a joint related issue, as in a fracture of a bone or the joints relating to the bone, or if it's a capsule related issue? So you have these different method of assessments and understanding what the pathology is, and then accordingly we have to address that patient, right? Scalenes anterior, medius posterior, and it's also very interesting. Sometimes it's all these experiences. People feel that you are like a very magic healer. When somebody comes to you and they complain of chest pain, right? Pain down the chest into the arms, and everybody knows that anything to the arm radiating to there is mostly understood as an angina. And you can understand the plight of the patient when they come, like they have a chest pain and they did an ECG, and ECG is normal. They went to a cardiologist, everything is normal. They don't believe it's something related to a muscle, right? And then when they come to us, and if somebody who knows a trigger point, I probably do a palpation. I find out the scalenes are very stiff, and when I try to press it and they get that, I reproduce the same pain, right? And then when I release the scalenes, and that pain is gone. And then they're like, with just using hands, you're actually treating. And and the patient believes that he was almost having a heart attack, and you treated a heart attack with, so don't try to clear what the patient feels and all that. But at the end of the day, I'm telling, all these gives you that confidence and, in treating. And also we all have, the scalenes and sternocleidomastoids is the most abused, muscles, especially with posture, with mobile phones. Everybody, like, it's like this now these days. You go to, sometimes when you're in a train, you find, with so many geos giving you unlimited offers, and you have mobile phones with like 256 and 126 GBs, whatever you can watch, like what you can save about 10 to 20 movies in your mobile phones, and people are like always have all saved it. And in a journey in a train, they kind of sit like this and watch TV, right? Watch movie, and then it's always like this. And you can actually notice that after a few, like about half an hour, 45 minutes, and then they're suddenly getting the pain, and they're like all this and this. The body is telling them, get up. You've been watching TV for so long. You're not supposed to do it. Do some exercise, and the body does it, and then they go back doing it and keep abusing. And so understanding what is there, and it is very important, right? And it also mimics what is called as, like, conditions like thoracic outlet syndrome, neuritis, and all this. So we'll talk about that as well in a few slides that is coming. Sphenius capitis, right? Very important muscles of the extension of the head. Just quickly, rhomboids major. You have this pain that is very common these days. Like, everybody comes with pain. We need to know how to address it, right? So I'm just trying to. So I just flash these name of muscles, and we'll tell you why. So trigger point characteristics. Pain often exquisite and is present at a discrete point. That is how it's a trigger point. A nodule is embedded within a taut band in the muscle. So you will find a muscle fiber, string of muscle fiber, very thick, and this band is almost in sometimes in either in the middle or along that taut band, right? And in Malayalam, you say the Nyarambu Tadichirikyana, Nyarambu Katti Pidichirikyana. So there's this thing about Nyarambu. Nobody knows what's it. Are we talking Nyarambu? Is it a nerve? Is it a blood vessel? And then today, since we are talking about myofascia, then is Nyarambu related to a myofascia? So there are a lot of understanding. Everybody has an understanding with their own practices, but when you try to discuss it, since it is so subjective, there is always conflict in opinions, right? So pressure reproduces the pain symptoms with radiations in a specific manner. Now, that is the brilliant part about trigger point therapy, and that is the differential diagnosis as well. So when you apply a pressure, when you find a trigger point, it reproduces that pain map, and then it's a trigger point. It's nothing else, right? So you use trigger point, and pain cannot be explained by findings from a neurological examinations, investigations, anything. You cannot find explanation. That's why people become very, what do you say, like a big fan of you, because pain is something that we can't really tolerate, right? As human beings, pain is something that we can always live with, and it is something very disturbing. And when you treat them with just simple things with hands, and almost instantly they are your patients forever, right? And it also induces autonomic changes, and that is also a very interesting thing about trigger points. So just simple steps how we find them. You use these like finger pads, flat fingers, and pincer palpation, all depending on the area. So if it's a sternocleidomastoid, then this is the technique use of pincer palpation method, right? Flat hands. And sometimes elbow, if it's a very hefty person, and if you want to find a trigger point probably in the glutes, then you probably have to use your elbow. Use your entire body, everything. So when you talk about trigger point therapy, how do you treat them? The options are injections, where they will directly inject on the trigger point. Dry needling, you use an acupuncture needle, you find the trigger point, you do spray and stretch techniques. There are different stretching methods, and you use ethyl chloride spray. And hands-on techniques, there's another slide which deals with that, stretch and release technique. So there is something which is called as reciprocal inhibition, we talked about, and think there is also isometric contractions, muscle energy techniques. Now, this is again something that you should all take note of. Muscle energy technique is very interesting, and it's a completely different subject. PNF is also a big thing, neurofelicitation, and that is also a big thing in the world of physiotherapy. So in hands-on techniques, we talk about inhibition compression technique is when you identify a trigger point and when you exert pressure for a certain time, and as the pain decreases, you increase the pressure. So it's a technique that you use in trigger point, and you can use trigger point tools like you see online, with a lot of tools you can actually use trigger points. You can use cupping therapy. Cupping for trigger points is very effective. Deep stroking massage is also very effective for trigger points, but you should understand that sometimes by just blindly massaging it very deeply, actually sometimes even aggravate the condition. So it's all about treating it judiciously, understanding the condition, and staying within the limit or the comfortable limit of the patient, and depending on the sensitiveness of the patient. So we see that, in clinic, some people are very sensitive to pain, so you don't really want to do very deep massages to them, but slowly start with an effleurage, do some ICT, like compression techniques on one area, release those muscles and stretch them, and then increase it. And then you have the manual lymphatic drainage. So all these structures that are there in the body and understanding them, right? So musculoskeletal mechanics, skeletal muscles work together to create and reverse movements. It's a group of muscles that actually work. So you have to remember about the concept of, just refresh agonist, antagonist, and synergist, right? So if you want to flex the elbow, right, the agonist becomes your biceps, your antagonist is your triceps, right? Because when one contracts, the other relaxes, right? And that has to be there for every joint. So when a joint is restricted, what we understand, we try to think about which muscle is probably restricted, which muscle is not holding tight, that is, and then we need to palpate and find out and then treat, right? And agonist, antagonist, and synergist is very, very important when we treat musculoskeletal conditions, right? And then we have the stretch reflex arc. You have one, so you have the quadriceps and the hamstrings here. When the hamstring contracts, the quadricep relaxes, and then when the quadricep contracts, and it's a simple technique why we can. So these are the stretch and release techniques that is, you can actually go online and do some research on. You can the post isometric relaxation technique, the post isometric stretches, for cervical pain and etc. This is very important because once you the norm is you identify a trigger point, we release the trigger point, and then we do stretches, right? So that is equally important while treating musculoskeletal conditions, right? And you have the crack technique, the contract, relax, antagonist. Contract is also the most sought after technique in the sports world, right? So just make points and please go online, because like I said, I wouldn't be able to stick within the time limit if I had to explain everything. So please go online, and I just give you like the isometric relaxation technique is you do an isometric stretching. So isometric is, I hope everybody knows, that you do a contraction without the moving of the muscle fiber. So for the cervical neck, so I compress my hand, and this is an isometric stretching. So what I do is I do an isometric contraction for some time, and after this I do a relaxation, and that is what is called as a post isometric relaxation technique. You have the reciprocal inhibition. So if this muscle is restricted, this is my biceps. If this is restricted, what I do is I would probably do an isometric relaxation of the antagonist muscle, and with the mechanism of reciprocal inhibition, the antagonist muscle also releases, and that's another technique. Contract, relax, antagonist contract is another technique where you give an isometric contraction. Again, it's the biceps that I'm just showing, right? You do an isometric contraction, and then you relax, and then you isometric contraction on the antagonist muscle, right? So please note down these, and please make it a habit to look into these names in YouTube. You will find a lot of videos. Muscle energy technique, very, very, very important. to understand. You can apply it in every musculoskeletal conditions, even in conditions like stroke rehabilitation, etc., along with our treatments. And then kinesiotaping is also something that is new. So if somebody comes with a neck pain as an osteopath or somebody who knows the trigger points, and how do you see it, right? We first look at the anatomy and the direction of the muscle fibers, and then we do like an ICT to the upper and middle trapezius, right? And then you come down to rhomboids to release it, right? And then see, this is what is called as a pincer palpation. You're doing the trigger point in the scalenes group, right? To the splenius capitis, right? Step 3 is and after you release these muscles, and then you just massage the area generously, and then you give proper stretches. And this is also another method. So for treating neck pain, all these muscles should be considered and then treated accordingly, right? The occipital frontalis, the is very, very important. This area, when somebody has a pain in the arms radiating, you go and try to, if you palpate, you see how painful it is, right? And after you release it, you give stretches, and you have different stretching methods. This is called as the towel stretch, flexor stretch, where you keep your hands like this, and then just move your hands. This is also a stretch, very good for the neck. Sternocleidomastoid, simple flexion extension. The chin tuck, all very, very relevant, especially for the the atlanto-occipital joints, the C1, C2, because you need to move your head going forward, because all these remains in a very position of stiffness when we don't actually do any kind of movements. Continuous sitting on the computer, all these tend to increase. So once you study about trigger points, the next thing that you have to go and look into are the myofascial meridians, or the fascia. The fascia is the place to look for the causes of disease and place to consult and begin the action of remedies in all diseases. And it was mentioned by Andrew Taylor still. I think a lot of people are raising hands. I think I'll just complete it, and we'll keep a separate section for question and answers. I think that'll be better. What is myofascia? Myofascia in general is a covering. We've learned that. Myofascia is the dense soft tissue which covers all your fascia. Muscles of bones. It also helps transport, move chemicals and other substances around the body. So what happens is, in the anatomy dissection, we see something like a myofascia, just cut open, and then you see the muscle, and we learn about one particular muscle. So biceps, origins here, inserts here, this is the action, that's it. And and this structure, that fascia is something that covers the entire body. It's there in the length and breadth of the body, and and we just cut it off. And probably myofascia, you spend probably 5 minutes in your entire 5.5 year course, and that's the only thing. That's how less we talk about myofascia. But in a human body, in a living body, myofascia plays a very huge role in the proper functioning of the body. So sadly, this is how we need to be when we come about a live human body. It's completely different from a cadaver or cadaver dissection. Cadaver dissections are good to understand what muscles are, how it works, but to understand how a body functions, I think we need to have a better picture, like a 3D image of a live human body, and then it's completely different. So myofascia connects many of the areas of the body together, hence also referred to as connective tissue. So you have it is all connective tissue. That's why when somebody has an ankle fracture or an ankle dislocation, and if it's not corrected properly, slowly his walking method is different, and then that affects one joint above the other, and completely his posture changes, right? So myofascial meridian. So when you talk about trigger points, the next thing that you should learn is myofascial meridians, because the trigger points, it is connected from one area to another through these myofascial meridians, right? So trigger points tend to emerge along certain predetermined lines of force or meridians, and the concept of myofascial channels or anatomy trains. This was done by Thomas Myers. He was a massage therapist, and later on he developed this science of anatomy trains and facial dissections, etc. And he kinds of does the dissection so brilliantly, and he has found and he has preserved these connections of fascia throughout the body and how it works. So these meridian maps may help to explain how and why the development of primary central trigger points in one area of the body may lead to secondary or satellite trigger points distally. So I'm just going to run through a few of these myofascial meridians, right? It's called the superficial front arm line, right? This is the superficial front arm line. It starts with the chest and inserts into the tip of the fingers. Now, this is how it is connected, right? So a condition that we see very commonly in the clinics today, we can relate to what we call as CTS, right? Carpal tunnel syndrome. The reason for CTS, everybody says, is when somebody uses excessive computer or mouse, when there is compression, that there is one cause of CTS. But we have seen in our practice that even housewives and people, all develop this kind of things. And I remember a few days back when Sreejit MD, like how he does, he shares these interesting, experiences, I remember him sharing about Dr. Sadhavan sir, and a tip from Rati ma'am, and then also from Joman doctor, and all these people. And I remember how Sadhavan sir gives the Bhrityadi Kashaya with Vettamaran Guliya, and how Rati ma'am talks about the importance of scalp edema, understanding, giving proper Murda Thaila to treat CTS, and German Joseph doctor, how he does cupping to release, and a lot of other and internal snehapana as well. So you need to understand the structure, understand the red flags, right? When there is a condition of wasting, then you really don't say it's a trigger point and you keep it. So there are different grades of CTS, 1, 2, 3, 4, and then based on that you trade. So proper assessment and understanding the condition is very, very important. So when you have a structure like this in your mind, right, so you should understand the problem here. It could be a problem in the forearm, it could be a problem in the arm, or it could be a problem starting right here, or problem right here. So there is, in osteopathy, what I've always found that, is that the site of the pain is something that only a patient should concentrate, whereas the physician or a practitioner should go away from the site of the pain and understand the root cause. And it has been very helpful for me in my practice, and it's understanding these conditions is very important. So again, this is another the deep front arm line, right? A condition that we see very today, decurve vein tenosynovitis, right? Everybody says they have this pain in the thumb, and we all say it's decurve vein tenosynovitis, and what's the option? You do go for a surgery, right? But it's when we understand these, if it is treatable and how we should treat, and what are the conditions or what are the structures that you should keep in mind, this is how we can understand. So you get a lot of this is a superficial back arm line. It starts from your trapezius over to the deltoid, and the forearm. So conditions like ulnar neuritis, when people come to you with they get up in the morning, they have stiffness in the fingers, they're not able to hold they say, especially they're not able to hold vegetables while cutting, they're having problems and tightness in this, and this is the structures that you have to go. You can search there will be issue with the shoulder, there'll be issue with the neck. And most of these people, when you take proper history, will be with irregular bath timings, applying cold oil, go online, go all these oils that you do without the understanding prakriti of the patient, you do apply oil, and this is what you get. Another structure, pain in the rhomboids, and they come with tingling sensation, right? This and the patient are very, very specific when they talk about the conditions. They tell you it's like this, it's like this, it's like this, it's like this. So it's these kind of movements that done. So if it's a throbbing pain, and they're like, this is the pain I get here, this is the pain I get here, this is the pain I get, and based on that, you should understand how that thing is there in the body. So the spiral oblique chain, right? This is for you to go and search about it. So I'm not going to explain what this is just giving a flash into that, right? So we need to understand this is how it is connected, right from the right part, and goes to the ipsilateral, the rhomboids, and goes to your friend, and the oblique is the tensor fasciae latae, it goes down to your neck, the legs, and goes again, travels upwards into your back. So it is all these connections that actually, when this is affected, that some people with back pain, have a problem with extension. They can't extend. But some people want, when they get this sudden pain, the entire body tilts to one side, like shifting in the hip. So it is all these chains that actually locks that body in that specific pattern. The lateral chains, right? Posterior sagittal chain. This is my favorite, and I'm so glad that whatever happens, whenever you learn all these things, it doesn't the Ayurveda doctors in you doesn't go away. That's the main thing with all these techniques, I felt, right? So I'll just go. Okay, so this is the posterior sagittal chain, and you can see it starts right from your just above your eyebrows, right, and it goes back along the entire chain, your neck, your back, the sacroiliac joint, right? It goes to your hamstring, it goes to your gastrocnemius, your calf muscles, and then it ends in the plantar area. So what it does is actually, and when you talk about plantar fasciitis, because when people come to you, right, they say when they get up from the bed, when they get up, they get this pain, right? So you should understand that what happens is in the morning when they get up, this entire fascia is being stretched, and that's why, since this fascia actually moves along that calcaneum and there is a area where it kind of folds and bends, so there is a lot of stress on that area, and sometimes it could be due to that as well. So having said that, in 2009, when as soon as I finished my course, the first thing I did was like a reorientation training in Panchkarma, and then I still remember Deep sir, how he taught us Agni Karma. And when I started my practice, Agni Karma was my major tool, right? Plantar fasciitis, I remember treating people who had plantar fasciitis like for 2 years, 1 year, they come to me, 1 or 2 sittings, I treat them, and then I heal. But now when I do it, I do Agni Karma very less, because I've always felt that, understanding this, sometimes giving a proper Moderator, sometimes relaxing or releasing the muscles of the calf muscle or the hamstrings actually relieve that tension. And people come, I make them sit on the on the consultation table. I do these release techniques on the calf and thighs, and then ask them to walk, and they said they feel a lot better, because they were waiting for me in my in the waiting area. They were sitting, and when they stood and they're walking, they had the pain, but when they get off my table, they didn't have the pain. So it like I said, it doesn't work always. Sometimes you have to do Agni Karma, but then you also have an additional something that, and understanding structures like this actually builds your confidence. And now I do so much research and so much study about Murdha, and it's such a subjective thing that you don't know which Murdha to give in which patient in which season, and the importance of it. And earlier Vaidyas in Kerala, sweared by Murdha, and it was such a lovely tool. And because in recent times, or like I would say in my practice in the initial days, because we are also concerned about the total cost of your prescription, right? For a 1 week medicine, this is the cost. And so we always think that we ignore the Murdha part. So let's go for a painkiller medicine, painkiller tablet, a painkiller liniment, ointment, lepa, or some kind of thing. Let's settle with that. No, it's not important. It's also, Murdha is also very, very important. So understanding the history, understanding the type, prakriti of the patient, and then applying the principle of myofascial meridians give you a lot of things. And the posterior oblique chain, those who have attended any Marma therapies workshop, or who have been under Marma, they have this what is called as a cross massage, where the patient, the hands and the legs will be pulled, and then you kind of massage, crisscross, massaging the thoracolumbar fascia, crossing it over, and then, so this is the structure that is, and because it's the most superficial, you have the latissimus dorsi, the glutes, and the tensor fasciae latae, all these muscles are being affected. So when you do a cross massage, it is very, very helpful. And then you have the anterior sagittal chain, like how because we are sitting continuously, and you have your abdomen is always contracted, and then it becomes very weak, and it's a major thing today due to continuous sitting, how it affects. Like you can also treat edema. Sometimes you have people coming probably after a long travel, they have like edema in the ankle joint. And sometimes what I see that I release this area, or I do some using a tool, I just massage this area and I release it, suddenly almost instantly the edema goes. If it's not a very underlying, if an underlying condition, a systemic condition is not there, like like a kidney or a liver issue is not there. But please remember in mind that whatever the names I mentioned about diseases, please don't say that all the edema is because of that's not my intention. I'm saying that yes, it could be liver related, it could be kidney related, it could be heart related, but then it also could be myofascial. So you're getting different aspects, and you can always choose according to your yukti. And so this is the deep anterior chain, the deep muscles of the abdomen, the adductor group of muscles. And this is the most important thing in the world of sports. And the sports osteopaths, the sports trainers, everybody swear by this, the importance of core strength, right? And this is where they look into building up of this core, releasing this core, improving the flexibility and increasing the strength of the core is what actually gives you, high performance in all these sports. So if understanding it is very important, right? Maybe you can also say that, when we treat a patient with vasti, probably it affects the deep muscles of the abdomen. Yes, all these muscles might be affected, but then if you have a picture, if you have a clear understanding, then you know exactly what you're treating. So when you talk about you talk about trigger points, we talk about myofascial meridians, and let's talk about the type muscle fibers and how it varies, right? So there are two, type 1 and type 2. Type 1 is postural and tend to respond to stress or overuse by shortening and becoming hypertonic. A trigger point in a muscle with a high percentage of type 1 fibers may take longer to respond or treat. So muscles that are postural muscles, like I'm sitting like this and there is a muscle that is working, for me to sit erect, is called more of a type 1. And what that does is, it is being overused, and the trigger points in those muscles will take a longer time to treat. Whereas type 2 is what is called for short and explosive activities, right? The best thing being a marathon runner, a marathon champion would have more of a type 1 muscle in his body, whereas a short sprinter like Usain Bolt will have a type 2 muscle fiber. So you need to understand which is a type 1, type 2, understanding the postures, understanding the actions, the explosive action that it does. Because tomorrow, with a lot of sports being played, you have a lot of these floodlight stadiums, you have these turf football grounds that is coming up around your locality. People are playing around, and then they come to you with an injury. So you should understand all these concepts, and only then can we treat them efficiently. So an example of posture muscles, all this, you can look for posture muscles, fascic muscles, all that. So how do we assess? Now this is very important. What is called as a good standing posture, what is called as we have something that is called as a plumb line test, right? So a plumb line test is basically when you tie something heavy, right? You tie it to the ceiling and you just drop, and you ask the patient to come and stand next to it, right? So okay, so a plumb line would include, like, a line. If you draw a line like this, right? So ideally, this is how a perfect posture should be like, right? You tie a rope from the ceiling, and you just tie it to a weight, and you just drop it, and you ask the patient to stand. So the external auditory meatus will be in line with your shoulder, just be in front of your elbow, the femur, the greater trochanter, and then just behind, the patella right across, and then to the lateral malleolus, right? So this is the so-called perfect posture. So it's a very good test. That when we do it, we understand, sometimes people are having a head forward posture, or a backward, or a lordosis, kyphosis. All this can be explained with this. So it's very interesting, to understand these methods of assessment and understanding, and this can be included in our darsana pariksha, like darsana, sparsana, and prashna. So the darsana aspect, yes, definitely we should consider the posture. because there is a very important study and being done, the importance of trigger points and posture, right? There's something called as the head forward posture, right? Like this. It's a continuous habitual posture that many people have because of the tight pectoralis and the tight suboccipitalis, because of continuous movement and without proper stretching. So these are some things that we need to understand. And now when we, there's also called as lower cross syndrome. There also you can look online, upper cross syndrome, lower cross syndrome, right? Please make a note. And then head to one side, occupational ergonomic stresses, lifting, carrying. So all important, the relevance of these in today's practice. I'm sure I've already talked about. Everybody are sitting on the laptops, everybody is sitting on the computers, attending webinars and social media, Facebook, Instagram, and always constantly abusing the body with improper posture. So treating them, educating the patient is also very important, right? Slouch standing, slouch sitting, sway back posture, cross-legged sitting, habitual postures. You have somebody coming, they sit in a chair with the legs crossed, and it becomes a habit. And what happens? Only those set of muscles are being contracted. So the ideal sitting posture is with feet slightly apart, erect, with your hip joint just above your knee joint, and then sitting straight. That's ideal, but none of us can actually do it because we are always so disturbed. Our body begins to compensate either with the cross leg, and then you're lifting legs and crossing over, or you're stretching your legs, flexing your legs, and all these different things to compensate all the discomfort that we feel, right? The effect of pelvic tilt on the hip and angle of the knee is very important. So if somebody has a bad posture, then it is also affecting the knee joint, the ankle joint. So there is a connection, like driving position, very, 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 very important, right? With so many cars in the market, we in the sense, we as consumers, we always go for either what suits our budget, and if you have a good budget, what suits our style, what suits our interest. And very rarely we think about cars that according to our height, the seat position, and that's the least thing that we talk about, right? And that actually plays a very, very vital role, because somebody who's having, and these bucket seats, it does make you feel that you're comfortable, but then this is what happens, because your knee joint is above, hip joint is below, there's so much stress on your lumbar muscles, and people are prone to, and with so much traveling, they're prone to disc prolapses, and continuous pain issues. So that's why we always tell patients who are drivers, I ask them to do proper exercises, strengthening their back. I ask them to take a break after every 60 kilometers or something, just take a walk and do some stretches, so that there's no buildup of these, of the stiffness or buildup of these issues in these muscles, which actually even restrict their movement, right? So that is something that we need to educate people as well. So see, this is the same person, the same car, but different, way of sitting, right? When you adjust the seats, and this is more like a comfortable level, whereas this is more in a non-comfortable level. So we have to be very aware about the ergonomics, right? So is it time for a break, as we said, or shall we continue?
Good morning to everyone. I hope the screen is visible.
Yes, doctor, it's visible.
Okay. Sitaram Ayurveda. Dear doctor, we are into the 100th years of operations. Sitaram Ayurveda, 100 years of healing legacy. Here I am introducing some of the major products of Sitaram Ayurveda along with the special classical products. Some of the Sitaram Ayurveda special classical products are Dhanyamla, which is available in 450 ml, 2 liters and 5 liters. And Dhanyamla, as you all know, which is used for the treatments of Dhanyamla Dhara, and also in some potli massages like Kiris, etc. And the next one is the Shadharanam capsule. Shadharanam capsule, which is from the Ashtanga Hridayam, the Shadharanam capsule. And we know the people are hesitated to take the Shadharanam guliga because of the smell of gomutra. In order to avoid that, we made the same ingredients to capsule form. That is the Shadharanam capsule. We have Shadharanam capsules, Churna, and also the Shadharanam Kashaya. Next, coming to the Amrudotaram Kashayam, which is a familiar Kashayam for all of us, which is used in the Amaja conditions for the mainly for the Jwara perspective it is mentioned. And in all the Amapajana conditions, we can prescribe the Amrudotaram Kashayam. It is available in Kashayam as well as the Kashayam tablet form. And next, coming to the few of the very special products like Karaskara Gridam, which is mentioned in the Sahasrayogam itself from the Kerala Ayurveda. And in the indication, it is mentioned that Kalin Muttadi Sandhyasridama Mariamaru Chonidam Nashayendi. And it is says that it is used for the Vadarakta perspective or the joint swelling, etc. in the mainly in the knee joint. Okay, next coming to the Kedaki Muladi Thailam, which is mainly mentioned for the sciatica as well as spondylosis and neuromuscular diseases. It is also a special product of Sitaram Ayurveda. Next, coming to the Balaguluchadi Kashayam, it is also for the Vadarakta perspective, Balaguluchadi Kashayam. And dear doctors, and next coming to the Misraga Sneham soft gel capsule. In the indication, it is mentioned that it is like a nectar or amrit, like Vriddhi Vidradi Shuleshu Vada Vyadishu Chamradam. As we all know, Misraga Sneham, which is mainly for the Gulminam Sramsanam Hidam. Like as we all know, for the Sramsanam as a laxative or as a purgative in the gastric and the rheumatic or arthritic conditions, which is from the Ashtanga Hridaya, which is also a special classical product of Sitaram Ayurveda. And next, coming to some of the proprietary products of Sitaram Ayurveda. The first one is KG 101 or the Kshira Guluji 101, which is, as we all know, like Kshira Bala 101, etc. We made Kshira Guluji, which is the main ingredients are the anti-arthritic herb Guluji potentiated 101 time using milk in Tilatailam base. And it provides strength and support to the ailing joints, and immunomodulatory action of Guluji aids in managing rheumatoid arthritis. And it also supports in treating gouty arthritis. As we all know, the Guluji, which is the Agraushada for Vadaraktam, Guluji, the ultimate in arresting joint degeneration and rigidity. So this is a formulation which is very effective for the rheumatoid and degenerative arthritis. The ideal dosage is 2 BID, and it is the ultimate remedy for the rheumatoid arthritis. And next, coming to the one of the major brands of Sitaram Ayurveda, that is soft gel sciatin soft gel capsule. From the name itself, we can understand the sciatin. It is for the sciatica nerve compressions, and the Rasana Saptakam and the Gulgulu Tiktakam, which are the two kashayams which we widely use in the practice for these conditions particularly. So the combination of Rasana Saptakam and Gulgulu Tiktakam fortified with Nirgundi Swarasam in the base of Eranda Thailam, and it is a combination of subsciatin soft gel capsule. It is a stronger 1 gram capsule. Okay, many of the companies don't have the 1 gram capsule. So the Sitaram subsciatin is a 1 gram capsule, which is at affordable price, and it lubricates and nourishes degenerating discs and vertebrae, and it improves the relaxation to reduce low back pain. As I mentioned earlier, the base is Eranda Thailam, so it improves the relaxation to reduce low back pain, and it also relaxes the sciatic nerve compression. And it's very effective in lumbar spondylosis and sciatica. Very effective in lumbar spondylosis and sciatica, and the dosage is 2 BID. Okay. And the next is I'm going to the sapling plus liniment. It is one of the liniment from Sitaram Ayurveda. And in the modern world, people are not ready to take the oils or the kurambu for the application purpose. So in order to get a quick relief from the sprain, stiffness, and frozen shoulder, we made the liniment sapling plus. So the sapling plus is a traditional anti-inflammatory properties of Chinchapatra Swarasam, eucalyptus oil, lemongrass oil, powered by Pudina and Ajamoja Sattvam. The main ingredient is Chinchapatra Swarasam, and which is along with the eucalyptus oil, lemongrass oil, and also Pudina and Ajamoja Sattvam. And the oil lubrication by penetrating deep into tissues, the liniment will go deep into the tissues, and it will give an analgesic as well as anti-edema action. And it is very fastly absorbing, and along with the anti-rheumatic and anti-arthritic ingredients, and that ingredients will give a quick relief from the sprain, stiffness, and frozen shoulder and back pain, and also can be used in the muscular pain and joint inflammations. And the usage is generally apply and massage gently. If fermentation is required, that can also be prescribed along with. So the sapling plus liniment is a quick relieving topical painkiller. And next, coming to the other area of Sitaram Ayurveda, it is the single herbs vegan capsule. We have introduced 10 single herbs in 600 mg extracts. It is a stronger carrying 600 mg extracts, and it is packed in plant origin capsule shell. That is the main importance. It is coming in plant origin capsule shell. That is vegan capsule. Many of the capsules are non-vegetarian in nature, but the single herbs of Sitaram is vegan in origin, vegan capsule, and it is presented in glass bottle packs of 60 capsules. It can be taken as a regular health supplement and also can be prescribed for the curative aspects. And we have 10 varieties: Amla, Ashwagandha, Brahmi, Gokshura, Gugulu, Kapikechu, Shallaki, Shadavari, Tagara, and Triphala. And in that, Ashwagandha, Gugulu, and Shallaki can be used in the rheumatic conditions as well. And next, coming to the one of the major specialty of Sitaram Ayurveda, that is Shivaguliga. Shivaguliga is a classical product, Shivaguliga, and the main importance of Sitaram Shivaguliga is it is the 4.5 gram pills. That is a Vibhidagi Pramanam as mentioned in the classical text. 4.5 gram pills of the ultimate Shilajit Rasayanam. The mighty Shilajit Rasayanam from classical Ayurveda, potentiated with the Jivaniya Ganam and Gomutra. Just see the importance is that it is the 4.5 gram pills, the Vibhidagi Pramanam as mentioned in text. It is very effective in metabolic, liver, spleen, and urinary disorders and diabetic complications, including impotence. It is mainly indicated for these conditions like metabolic, liver, spleen, and urinary disorders. And also, it's very effective in the diabetic complications, which includes the impotence. The ideal dosage is 1 BID with warm milk. The major importance is that 4.5 gram pills. You can see in the picture, it is a 4.5 gram pill. The ultimate Shilajit medicament in its original size and efficacy. So doctors, if you have any support, if you need any support from the Sitaram Ayurveda, you can log on to www.sitaramayurveda.com. And we have started sending e-certificates to all the participants who attended this webinar for more than 75 minutes. If you are attending our AACHAARA Rasayanam for more than 75 minutes, you will get an e-certificate to your email. And we are sending the notes and the recordings to the email ID, which is the registration used for registration by the subsequent Saturday. You will get the recordings as well as the show notes of the AACHAARA Rasayanam by the subsequent Saturday. If you could not find that mail in your inbox, please check spam folder, promotional folder, social folder, or career folder. If you cannot find the notes and recordings in your email, please check the spam or promotional folder. For any support from the Sitaram Ayurveda, please contact Mr. Rajiv, our customer relations manager at 90726-13194. I repeat, 90726-13194. Or you can send an email to Mr. Rajiv in crm.osk@sitaramayurveda.biz. crm.osk@sitaramayurveda.biz. So thank you, doctors, for your patient listening. Now over to Sreejit sir for continuing the session.
Okay, so we just talked about the trigger points and the myofascial meridian. So this is another video that I found very interesting and again very relevant.
Prolonged sitting in a flexed posture. Part 1: biomechanical symptoms. Lower
biomechanics body. Very important.
Do you recognize this sitting position? Do you sit most hours of the?
Isn't this the very common thing that we talk about, right? So the blue color muscles, or the muscles that is in blue color, which is in constant flexion, right? And the green ones is the extension. So we have the concept of overused muscle and underused muscle, right? So when you are sitting, constant, your hamstrings are always in a contracted and a continuous position, and that leads to a lot of problems and stiffness, and it kind of pulls that whole, your calf and in your back, and leads to a lot of other complications. Again, yes, you see.
Do you
all
feel
this,
discomfort or pain in your upper or lower back? What happens to your body when you slump in your chair for too long? Prolonged sitting in this position will in time cause rigidity and tightness in the tight muscles. We can see them colored in blue. Now, these are chronically short muscles, what we call locked short. In addition to the posterior leg muscles, the hip flexors are also chronically short from prolonged sitting. Rigidity in the hip flexors is a direct cause of weakness in the antagonist hip extenders. Muscle imbalance. Muscle imbalances are the number one cause of lower back pain.
Again, like I said, muscle imbalances, right? So this is the whole basis of it. We need to understand how a set of muscles. We have to refresh the concept of agonist, antagonist, and synergist, how it works and how it moves in the joints, and then we understand the muscle imbalances. Only then we can treat. We can focus more on the muscle that is overused, right, and the underused. It's the treatment modality is not the same for even in the same human body, right? So we kind of think, oh, okay, this person sits for a long time. You can see his hamstring is overused, whereas his the quadriceps are underused. So what we need to do, we need to give him, we need to release the hamstrings, stretch the hamstring, and we need to strengthen the quadriceps. It kind of only then can we compensate the improper balance in the body.
Prolonged sitting in a flexed posture we call locked short. The posterior leg muscles, the hip flexors, are also chronically short from prolonged sitting. Rigidity in the hip flexors is a direct cause of weakness in the antagonist hip extenders. Muscle imbalance. Muscle imbalances are the number one cause of lower back pain. What happens to the sacroiliac joint? The joint between the sacrum and the pelvic bones. The sacroiliac joint and the sacroiliac ligaments are under load.
SI joint dysfunction.
What happens to the lumbar spine? Here we can see a neutral spine and lumbar flexion. In prolonged slumped posture, the lumbar spine is flexed over time. Damage includes increase in posterior annulus strain, damage to the annulus of the disc. Spine is flexed over time. Damage includes increase in posterior annulus strain, damage to the annulus of the disc. Increase in intradiscal pressure. What happens to the connective tissues?
So please note that, when you're continuously sitting, there is a contraction of
flexed
your
postures place stress on the posterior passive tissues.
Muscle, contraction of your deep
In addition,
abdominal muscles.
the posterior ligaments
and
are
all this
also
leads
impaired.
to what is called as, the improper imbalances and causes disc prolapse and all these different conditions,
In the second part of the video, we'll learn the biomechanical symptoms in the upper body.
So when you talk about back pain, it's not only the muscles in the back that are, actually responsible for it. So you have the entire, the chain. It could be tight hamstrings and tight, calf muscles both together can actually give you pain in the back. It can give you a pain, imbalance in the muscle of the lower back muscle. It give you conditions like, sacroiliitis. It give you conditions like disc bulge. So, and it's very interesting. Like every time earlier, in my as my practice started, when somebody comes an X-ray, and we feel that X-ray it's a very the body is very weak, because we see X-ray as just like that, and bones are floating, and we don't realize that how strong the human body is. So it takes a lot of force to actually mobilize and manipulate, and so we need to get that concept, and that's why how we should actually see it in this way. This is how the human body is. It is so complicated with so many ligaments and supporting structures, so it's not that very fragile, right? So we can easily do a lot of techniques and stretches and all within the limits of its range of motion, right? So to understand the concept of disc prolapse, and we need to understand how what are the muscles that is connected, the imbalance of those muscles, and then when we do it, we do proper massages on these muscles, and then we release and stretch and release certain muscles to give strength to the other muscles. So we need to understand that concept, and we need to work on ways to actually bring back these balance. And this is probably another, how it affects the organs. Right now, you have the musculoskeletal systems, you have the improper postures, how it actually affects. We all know that continuous sitting gives you gastritis, right? Somebody who's having a job with, continuous sitting, he has difficulty in digestion. He has issues like gastritis. What could be the reason? Because it could be, the nerve that is supplying, the T60, 70, and all the thoracic vertebrae, the nerves that actually supplies to the visceral part. So how it is affected? Somebody is having an upper back, somebody fall down, like an upper back injury, like somebody around the T1, T2, T3, T4 line, and if there's an injury, then sometimes he has a difficulty of breathing, right? So it all affects the organ as well, and that is why it is important, how proper posture and importance of proper, balance in the muscles and the skeletal system, which also affects the organs. So there is a lot of study going on, and we also know how in our science, how Neerarakam, like applying wrong oil, having bath after sweating, all that affects your, you get cervical pain, you also get gastritic issues, how the vagus nerve is affected, phrenic nerve is affected, which supplies the diaphragm, and so how your breathing can be impaired with Neerarakam, how your digestion can be impaired with Neerarakam, and how it affects the different organs. So there is a lot of connections. And also we also have this concept of the different roga margas that you have, Madhyama roga margas. So, and applying probably to understand the roga marga, I think fascia and its connection has always kind of given me that, I wouldn't say it is that, but I would say probably this is something that gives you a lot of light. So there's a very interesting thing in osteopathy, and when you're talking about rehabilitation of these joints, and when you're talking about musculoskeletal conditions, your end aim should be like this, because there are certain mobiles joints which are very stable, and we should always increase the stability, but there are certain joints you should also make sure that they're very mobile, right? So this is a very good illustration for all that. So your toes should always be mobile. What that means is, when you're walking, right, to absorb that pressure, your toes should just move in a very small, you're just talking about very, and it kind of gives that cushioning effect. Only if your toes move, is very mobile, will you give that thing. And when you talk about your feet, it should be steady, right? So it should be stable. And your ankle, you have your talus, and you have your, the main junction, your ankle joint, your tibiofibular and joint. So what happens, that should be mobile. It shouldn't be thick. So when you come after an injury, let's say pronation injury or supination trauma or pronation, and what happens is, sometimes it gets stuck. And we as practitioners, it's seen in nowadays that somebody has a sprained ankle. What do you do? We do a POP bandage for this many days, and then we ask for a physiotherapy. So after the POP, physiotherapist, what he will only try to do the range of motion. He will just try to do a range of motion in a passive manner, which means the patient will be on the bed. The physiotherapist will do methods that will increase the range of motion in a passive manner, right? The therapist will be doing the range of motion, but we need to ensure that it is done actively, because when the patient starts walking, he should be free from pain, and he should have restored that mobility in that joint. Only then, he's completely recovered. So, and that is where actually our method of bandaging with Murivanna, all that comes into play, because we are also giving Snehana, and with that we are also removing these stiffness. And then by applying the principles of biomechanics, and if you assist it with little mobilizations and manipulations, what you're doing is you're bringing that joint back into its normal self. Knee, it is very important. It becomes very stable. Your hip joint should be mobile. Your low back should be stable. Your upper back should be mobile. So, it's understand the concept, and your shoulder base should be always stable, and what your shoulders should be mobile. So, and upper and lower neck should be stable, and your upper neck should be mobile. So this is this concept and how it works, and how we should eventually, bring that mobility and stability aspect to the body, right? And next is how we probably see there is a kinetic chain of mobility and stability. We see which is the weak chain, and then we treat and after we treat that, the entire body becomes normal. Because if any of this is disturbed, what happens? It affects the stability of the entire body. That's the whole idea. If sometimes if your ankle is not mobile, if it is very stiff and something, your walking is not proper, it affects your knee, it compensates into hip, thoracic, even to the head. So sometimes you also get, I've heard a case when, I don't remember which doctor, a very senior doctor, for a constant headache, there was this kid who had a constant headache, and a lot of doctors treated and they didn't know one. And in the end, the doctor found out that he had like what is called as a difference in a leg length discrepancy. There's one leg was shorter than the other, and he suggested a footwear to actually compensate it. And when the child actually wore that footwear, it treated his headache. So all these things, these are different aspects as well that you can actually consider. So how do we learned about trigger points, we talked about myofascial, the chains, and what is it, how is this whole process, how do we club it together, First is, of course, test protocols, posture assessments, this comes into our the darsana aspect, darsana, sparsana, and prasna. So you have these, the darsana parisha is definitely where you should understand the posture, see if this person is having a hunchback, and you can identically see that his thoracic vertebrae is high, there is hyperkyphosis. So what do you do? Then you try to correct it, and you give strength into the muscles that actually brings it back to the normal. That's one way of assessing. Movement assessment. So sometimes what happens is in steady posture, it might be normal. Then when you're asking the person to walk, and you can see there are different gait is there, the gaits, and sometimes there is a imbalance in the hip movements. Either there could be a restriction in the shoulder, all that. So movement assessment. And when you go to sports, then you also ask them people to do squats, like gait tests, and then you also go for a range of motion test. So you go to a joint, let's see the range of motion. You do a flexion, extension, inversion, aversion, all those tests, and you see if it's working. And then next is what is called as an isolated strength test. So range of motion test is when you do for the joints. The strength test is actually you give a counter force for about 10 seconds and to see if it gives away. So you see how it is working, and how do we correct it? So once we do proper, then we analyze the condition, correction. So first we always go for is a soft tissue mobilization. That's what we call in Broadway. So so sports tissue, in soft tissue mobilization, the tools that we can use are cupping, right? You can do what is a SMR or a tennis ball or a tiger tail. So the tennis ball I already showed in that trigger point video, like how you can use something hard like a ball to actually release it. And then what is called as IASTM. This is instrument assisted soft tissue mobilization. So please make a note of all this. Like next, again, targets what you all should study: cupping. We should also do compression, ICT, inhibit compression techniques for trigger points, trigger point release using a tennis ball, right? IASTM, instrument assisted soft tissue mobilization. Flossing technique. Again, you can see it online. Just take a picture, go online, start searching trigger point therapy, right? So sports cupping, made very, very famous by, I hope you know, this is Michael Phelps, the famous swimmer from America. And you can see that American team, how, they integrated, this cupping into it. So sports osteopaths are in huge demand in the West. You can see cupping marks because it helps in the recovery, right? You can see cupping being performed. You can see bodybuilders, right? And then you have the SMR. SMR is nothing but soft myofascial release, right? So you do like muscle energy techniques. You stretch the myofascia, you release it, use a tennis ball, and then you can use these tools. Like you have these massage guns that are available, percussion massage guns, very, very handy. It all reduces your load as a practitioner and gives almost immediate effect to the patient, right? These are the massage tools. You have the foam roller, you have the massage stick that you can use. I use everything, everything in the sense, whichever is possible on which patient, I just do it, and it's very interesting. So this is a muscle roller. So you understand the concept of trigger points, you understand the concept of myofascial release, and then you have tools that are available, because technology is constantly improving and people are coming with new gadgets. So we have to be updated. Otherwise, we are just sitting back and in the dark ages and talking about the mighty of Ayurveda without actually integrating what is there because if you notice, if you have the Samhitas and the Charaka Samhita, so all this was something that we get is been written over a specific timeline. It's not something that one person in his lifetime he wrote a book. No, it's a collection of what we said. So I was thinking that if Susmita Acharya was alive today, he would probably add all these into an Anashastra or something like that. He would have a different category of these tools. But we are not broad-minded enough to actually accept it. And that's a difference. And I think we should go away from that. So this is a technique of foam rolling, right? How use and athletes are getting educated about the importance of self-recovery. So that's a big thing in today's world. You can see him releasing his tight calf muscles, how he used to massage balls and do it. This is what is called as instrument-assisted soft tissue mobilization, IASTM. It's a huge thing in the sports osteopathy. When it talks about recovery, you remove the facial adhesions. It is very, very important, right? And then you have the flossing technique. So basically, flossing is nothing but a very tight rubber band. You just tie it around, the leg, and you just do some massages and some stretching. You do some active and passive movements with it. It kind of stimulates the entire area and helps in the rehabilitation of the muscle. So you have so many options. And kinesio taping, like I said, for trigger points, right? You can just put a tape, leave it on a patient, ask them to come. You can do a trigger point release and then do some stretching, and you apply the tape and go and give it. And at the same time, you can give internal medicines. Now, that is the strength of an Ayurvedic doctor, because I don't personally say that, you should all substitute these therapies with your existing treatment protocols, everything. No, I'm always asking, and I was very particular about integrating it, because only an Ayurvedic doctor or probably a Siddha doctor, we have the concept of what is called as ama and nirama and the mutrala and all these and how it affects the musculoskeletal system. So if you're doing a trigger point release, and if you're giving like a myofascial release, if you're giving a kinesio taping, if you're sending the patient and you're giving internal medicines like an ama pachna or a mutrala medicines, and it actually has double effect to the patients than by just giving these techniques and some pain medication. So it has really helped in my practice, and it's based on the feedback of the patients, like I said. So stretching, you have the post isometric stretching, you have the crack, that is the contract, relax, antagonist contract technique, and then you have combined with stretch with cupping and stretch with IASTM. So what do you talk about? This is something that in the sports world as well, you do cupping, right? And then you introduce stretching as for the muscles as well. So that is something that is, and they are always evolving. And there is also stretch with IASTM. So you use the blades to actually release those facial adhesions, and then you also bring into stretching of those muscles. So it helps in the recovery. So once you do a proper soft tissue mobilization, then you should focus on joint mobilization. So in a joint mobilization technique, there's something called as a power band technique. This is something technique, you just hold that contraction, and then you just do a simple flexion extension, and you can see to mobilize the back. It's so once if you can learn to properly mobilize it, then there is no need of manipulation, right? Or the thrust techniques. But ideally, you should understand, the vectors like of a particular joint, the flexion, extension, rotation, and then you try to bring it and release it, right? And then you can also learn, manipulation techniques. So it's a small introduction, give you a little sight of what the thrust, it's a demo of the osteopathic thrust techniques, right? C3, C5, you bring into a slide flexion, rotation, and you find a bind. And you just give a high amplitude, a high velocity, low amplitude thrust. It's very fast. It's about finding that bind and doing it. This is how you correct your C71. This is how we do it for your thoracic. You have a lot of patients who are coming like this out, and you feel that, and you do a pain provocative test. You press the point and feel the pain, then you can do a correction. This is how we do for that. L1, L2. The posture is important. Find the bind. You can do specific thrust in these areas. There's a lot of techniques available to adapt it, use your body weight. It's not very complicated, or it's not high risk at all. You have your assistants very easily. So, that's the different thrust techniques that I do, depending on the conditions. And so when you're coming back, where does it all fall in? And very interestingly, you have these different techniques of marma manipulation that we have already seen or heard, and and it's snehana is there, swedana is there, mardana, pidana, veshtana. And so mardana and pidana is deep pressure without oil. So you have techniques of marma manipulation, and you don't know how it works. So there are certain areas where you have to press really hard. Pidana was mentioned in our classics, but we don't know what it is. Mardana, different types of techniques that was there, and we still don't know what it actually means. Veshtana is bandaging. Now they're coming with flossing techniques, they're coming with bandaging techniques, but think about the effect of a marma labor bandage would have as to just plain bandages or just POP. That's where we always have that upper hand. When with our medicines, it is so powerful and time tested, and it is something that we need to all start understanding it. And we have these modern equipments and tools as well. So it's like belladonna plaster, something that is very available today, and people use it for pain, etc. And I tried using a marma labor and then a belladonna on it, because sometimes people are in certain areas you can do a bandage, and I found it very, very effective, right? So it's very interesting, and I'm just trying to play around just with whatever tools are available. And then you have lepana, and trashna, agni karma. You talk about agni karma, and one of the recent workshop that I attended, they came with a physiotherapy equipment, and they came with a laser therapy unit. It was like the high end laser therapy equipment, right from made in Germany, and it cost about 25 lakhs, right? And it had all these functions of diagnosing and treating it, and it's a very simple thing, and they're using laser, right? So there's so much of advancement in that level. And so tomorrow, if some of these big hospitals are going to come up and start laser therapy for the pain management, and trust me, people would prefer going there than coming to us, because there's no hassle of removing clothes, there's no hassle of oil wiping off, there's no hassle of 1.5 hour session, 14-day session. They can go do their work, come back, and just go for a 15 to 20 minutes of a laser therapy, and it is going to work. So again, we have to be updated, we have to know what is going around, otherwise we just be left out of the rat race. That's it. And Suji Barana is also mentioned in marma manipulations, and Suji Barana is about not just, as it says, it's not about poking needles, it's about using sharp instruments, right? So marma is not just about using hands. There are certain practices of using tools, there are practices of using medicines, there are practices of using energy, and a lot of concepts. So that's why marma is very controversial, because it is very subjective. The practitioner has his knowledge about that science and his experience of that science, and the patient has their experience of witnessing it. And sometimes it is, and since it is a subjective thing, it is always in a controversy and in a gray light. But it's about understanding and exploring it and understanding according to your Yukti. And then, of course, Dr. Mokshana, I'm sure Dr. Sreejit MD sir has n number of videos on his, YouTube, and he's always promoting it in such a way, and a lot of doctors are practicing. So these are different techniques, but it's all about understanding where to do, what to do, when to do, and that's the difference. So having said that, the famous sloka, Ekam Shastra Madhyano Nidhyasasana Tasmat Bhasura Shastra Vijnane Chikitsa. I think this is what he meant. We should be updated about all the Shastra that is happening around. We should be updated of everything that is available. And I thank God for the attitude that I have. One thing is, like, I just don't ignore, or I just don't look down on anything. I see probably, if somebody who's like a bus conductor by profession, but is in the evening, he's doing some kind of, one therapy that is he gained from his fathers, I make an attempt to go and understand what he's doing, because I just don't stay away just thinking that he's, probably a bus conductor, I shouldn't do it, or he was a quack. But, there are a lot of practitioners and a lot of these simple techniques that, some families have passed on generations. And, as doctors, it is always good to understand what these are. And that's the whole idea of it. So this is what it means, and study of single Shastra, a man can't understand this. We need multiple Shastra. It doesn't mean that you have to only follow, the modern medicine. You have to be thorough with everything. That's what I feel. And once you learn all this, and, you definitely know how it's going to do it in your practice. So that's all I have to say about, osteopathy. So I hope it was interesting. I hope it was a learning curve for many. I know I'm really honored, like about 280 plus participants I can see at one time. So over to you, Sri sir.
As expected, because I have attended your class before, and as expected, there are plenty of questions. So Dr. Vignesh is also here. He will manage the questions, how it is. And there are many key points we take away. Is that one is that this empowers the Vaidya or the doctor, because then you are the big boss. That gives a good feel in a strategic setup of a clinic, where a therapist sometimes thinks he is the reason for a patient coming. As you know, that everyone who is handling hospitals know that fact. So that is one, that everyone knows who is the boss. Secondly, the impact is so quick. Thirdly, it has a good personal rapport with the patient. It gives a connect more than a prescriber of medicine and a drinker of medicine. There's a connect personally and professionally, and that is always a very handy situation in the healing process, which is always never straight lines, ups and downs. So these strategic reasons, along with the medical efficacy that this has, makes it very, very fantastic to be imbibed in our practice. And that is why we were very enthusiastically spreading the message to all the doctors that this is a chance to empower yourself and give a quicker healing and lasting healing also. And as we saw the bands, we saw everything that you had shown. And even for me, the most striking point, which I had noted in the previous webinars of yours also, is that neurological pain without a neurological finding. This is, they beat around the bush unless they know this aspect. Another thing is that the point of trigger, how it can be so done with a tennis ball also, and so handy. And these days and times where we have all the ergonomics related, it is so relevant and so important. And the laptop, the neck and the shoulder, so commonly needed. So I think we should directly get into the questions. Dr. Vignesh would take over that. So I think further things, your email addresses, your phone is there, and we all see your contribution, the groups. And I will be forwarding that cupping today itself, the cupping experience. Now it's more than 10 days, as promised to you. I haven't forgotten.
Yeah, that was, I wish to share it,
Yeah. So I think I will hand over now to you and to Dr. Vignesh, and then I think people will be more.
I'll just, you just reminded me of 2 points. Like, one is how the physician is the boss, right? So even in my practice, initial in my practice, it's always a challenge to get a good therapist and to retain them, right? And when you do it and the patient comes to you, and then you have a 14-day of rapport, the patient and the therapist, and they have their own plans. So the next year I realized that actually the therapist goes to the patient's house and does the therapy, right? And you do all the hard work. So it's a major thing. But with these things and with these techniques, and this is something that I do, and what I've done is, like, it just came out of practice, that every session or every day or before every session or after every session, I make a point to see the patient and the therapist together, and I do a proper what do you say, assessment, and I do a proper to find out what the main issue is, and then I focus on that area, and then I tell the therapist that, see, this is what you have to do in this area, you have to focus more. So that gives a good rapport, like, the patient is happy that the doctor has instructed it, therapist knows that, okay, the doctor told it in front of the patient, so he has to do it, and so you're in a win-win situation, and then the patient will also realize, so it's not just the therapist, it's actually the supervision of the doctor is equally important, because only then he's getting that desired result. So that is something that I've learned. And the second thing that you told about was that cupping experience. So no, that was like a very it was a very acute pain, and I know that person personally, and then she always comes to me, she always runs to me, and then she swears by me. She's like, no, any issue only Shine can treat. And I was like in a very dilemma, like, because I can see the pain they're in, and I'm doing the proper clinical assessments. No, I know it's not appendicitis. I know there's no another major issues, but it's something related to the food that they have. And it's this severe, gastric thing that sometimes you get, and they were literally rolling. So I was ruling out, no, it's not kidney stones. And then I said, okay, let me try it. And that's when I did, like, cupping on the umbilical area. And then it was magical. And then, she was like rolling with pain. And then, and with, you just did cupping for 10 minutes, and then she actually dozed out for about, she was sleeping for about 3 minutes, and then she woke up and she just started running, and I followed her for like 1, 2, 3 days, and she's like, no issues. And then she was very active person, and she was taking her family out for, she wasn't that, so she's a housewife, and she had a lot of guests at home. So, and she was feeling so bad about it, because, she's that active person. She has to take care of everyone, and then she can't be alone. And that's why she was very upset. And even I told her, like, let me refer to your hospital. I want to get a USG done. And then she said, no, you do it something. And then that's when actually, out of instinct, I did it, and I realized. So basically what I've done is I've just, corrected the, the imbalance that was there using cupping. I just did some suction, and then it pulling the umbilical actually probably corrected the viscera or corrected the air that was inside, like probably a vata vagunate was there. There was an obstruction of water was clearly the point. And when I did that, it actually removed, and almost instantaneous it was result. So thank you, sir, for reminding me.
Yeah, no, because as I promised to you, I did not want the other group members in other groups to realize it was a one fluke and 1 day impact. Now that 10 days have passed, so I thought I'll dig up the matter, and then I will put it across that it's 10 days over, the result still sustains. Because sustainability is a major issue.
Yeah, she came yesterday also with another of her relative, and she was like, no, I'm not perfectly all right. I was like, wow. Absolutely. So that's you realize the more you do these things, you understand how less you know about it, the human body. Yeah, so that's keeps you humble as well.
So there is a question or rather request from Dr. Smita Deshmukh. Can you please share any spine manipulation video? I think that was happening anyway. And cupping therapy procedure video any share. So I think your website may give that, maybe that.
I have a Facebook page, Dr. Shine Mohan Talapully. You can just like it, and I probably post all my events there. So
yeah, so I think that will quite a bit answer to many of the questions that are there, because you would be making anyway the references of the same, no? That is easier. And where can we buy IASTM?
Okay, so it's about, I think it is available online. You can get it from Amazon. IASTM tools it is. I would always suggest, try to do a good course. A lot of people are offering IASTM courses. So when you attend these courses, you always have a better understanding of using them. IASTM, sometimes what happens is, with these trigger point therapies, you don't carry your tools all the time. So sometimes when I go to my relative's home and someone says with the point, and I realize it's a trigger point, so I go to a probably kitchen, and I get like the balen we use for rolling chapatis. That's a good tool for me. And it's all about innovating things. So it's anything hard because if you do it with your hands, your thumb actually takes a lot of pressure. So tools you can buy it online.
I think Dr. Sreejit is muted. So, Dr. Sreejit is back.
Yes. Doctor, if you could tell us any kind of pathyam that you follow. I know we are dealing mechanical, but still we can't forget the functional part of it.
Yeah.
So
So
how
I
would
think musculoskeletal conditions, you always think about, I always go for like a, maintain the pitta-hara. That's what I mainly focus on. So I strictly say no red chilies, no masalas, deep fried, be it veg or non-veg, And interestingly, sometimes like, and I always prefer I ask people to have more like kanji, which gives you that more alkaline thing to the body. Hydration is very, very important, right? And like how we talk about, like melon family, like cucumbers or, the watermelon or, all that has a big role in. And I always talk about, less masalas, less chips and all that deep fried, the basic thing. But I've somehow found even patients coming to me like, I tell them, right, don't have it. So even if you're having like, let's say chicken, right? What people do is you literally abuse that whole thing with so much of masala and red chili and all that. And I have people actually coming to me and saying that when they have it with just plain green chili and green pepper, there's a Pareto model that we do it in, like, a classical local thing, and when you have it that way, they don't aggravate these symptoms. So I sometimes, after initial patyan, I tell them, see, if you want to have non-veg, this is how we should have it. Either, just have it with basic, spices like green chili or, pepper, and it's fine. And so this is something that I vouch on. Yeah. And also bath timings is must. The history will have bath timings. My history will have posture that they follow, their work they do. My history would have all these, right?
Yeah. So I think it is pretty much the Kaya Chikitsa module that we follow, because no, it is very much as we normally follow the protocol. The Shobha, the Ama, the Vidagda, Vishtamba, those group of entities automatically come into it. Yes. Anyway, it's just that you are adding a mechanical angle to it, a manipulation angle to it, and that is Vaidya centric and Vaidya empowered, if I may use that word.
Yeah. Yes. Because see, we have so much of information about the anatomy. We have so much, tools that are being developed, and which is because earlier, if you see, calorie manipulations were done using your feet, right? And people were using, even though it's the same effect, nowadays we have these proper chiropractic tables which you can adjust with, the hydraulic ones, we can adjust the height of it, and then the techniques have improvised where you use the body weight of the therapist or the doctor. You don't have to use your hands where you're overusing and you're just wearing off. No, they use proper techniques, and I learned those techniques by attending different, and they also teach you how to do the technique effectively at the same time saving your body. So all these things are happening. So if you can update it, then you can integrate both. That's the whole idea.
I think most of the questions are already answered, and somebody was asking if we have an online course. I think the Facebook would answer that, and about Shiva Gulika already clarified by Dr. Rahul. Almost everything is kind of cleared off. That's what I can see here. Please let me know if there's something that is missing from my side, but I've scrolled through everything.
Doctor, I have a few questions. Yeah. So first of all, Dr. Shine, thank you so much for bringing this idea that how we can integrate it into our practice. And I must say, one of my colleagues, Dr. Jobin, he attended your class on dry cupping, and we use it so much that it is really helping people with neck pain, and also looking at all the trigger points. So there is one thing that I would like to add. In some cases, when we see that, when the patient would say, I'm having severe neck pain, and they would say, I'm not able to move right and left. And then when we touch some of those trigger points, and you could say that it will be like they're getting an electric shock. Mm-hmm. And what we understood
in some cases, before we do the dry cupping, after we do a kashaya dara or a dhanyamla dara, and then after 2 days, we release that stiffness and the shobam. And then when we do the dry cupping, the result is just phenomenal. And they say that, oh my God, I wasted so much money with MRI and going to many other doctors. And this is like, finally, I feel that my handbrake has been put down so I can move easily.
Yeah.
So this is one thing I found out. So, doctor, one question: do you think pillows make an important? Do you have any suggestions for the use of pillows? Like sometimes you see that when I tell patients you should not use thick pillows. If you use a thin pillow, the neck pain will not be as severe. So, what is your recommendation there?
Okay, so I think for generally my pillow rule is that if you're a person who are always lying on your back, then I always suggest them to use very thin pillows.
Mm-hmm.
But if you're a person who's a habitual sideline, then I always tell them to use pillows that would compensate the width of the shoulder gap.
Mm-hmm.
Because what happens is sometimes it's like this. Neck pain, use a small pillow, sleep without a pillow. So if this person is a habitual side, is a person who you have this habitual postures that you sleep in, right? Some people, if the side lying position, and just because the doctor said don't use a pillow, he'll be like sleeping the whole day like this, and that again causes that muscle imbalance. So I always tell the people, if you prefer to sleep more on your sides, then make sure you have a thick pillow which actually negates this gap between the shoulder and thing, right? And
Yes.
I think when you talk about, and it's a very relevant point that you said about the importance of doing some dhara and thing before, doing. I think it's about again that comes when you do. Even if you're doing a trigger point therapy, you should always do a dosha prakriti and the deha prakriti is very important. So if this person is a more like a pitta thing, and then if you talk about the sensitiveness they have, then I would actually refrain from doing any therapies right on. I usually give a lepa. I ask them to do lepa for 3 days and then come back and then do the therapy, right? Sometimes what happens in these people, if it's like more like a sensitive skin, and when you do therapy, it kind of aggravates these symptoms. So I think we need to be judicious about how and when to use it. If it's and I've seen this especially in ladies, like high pitta, with so much stool. But I've always felt that these manipulations are always very helpful, almost instantaneously when you do these, because it's very fast, and it kind of works in this whole, the neuro muscular. With these manipulations, it also releases the spasm in the muscles. So it's sometimes it's very effective. Yeah.
And doctor, there's another experience that I would like to share. After the cupping, they say that it's relieved, and then sometimes, especially people who are into lifting weights, they get, especially in the trapezius muscles, they will have some trigger points that will get activated, and the pain is quite terrible. So when I spoke to some osteopaths from abroad, what they're saying is, whenever there is a vitamin D3 deficiency or B12 deficiency, the tendency of these trigger points to get activated is much high. Have you had any experience with that, or can you relate with these?
So I wouldn't, I don't think I don't have any experience, per se about the vitamin D3 as well. But or in my mind, I also make sure the concept of Agni is very, because that's the thing. Vitamin D3. What I believe is, yes, even though people are exposing to sun, it has to be absorbed in the body, and so that is something related to more of an Agni issue, right? So I focus on that. So if I give like a Pachna Deepna, I focus more on that, and probably even I will do a Sadhya Virejana before treating the patient. And correct is Agni, and then I do it, and then I don't really have this, So I wouldn't vouch for these therapies alone, like doing cupping alone or doing trigger point alone. It's all about integrating and playing it.
Yeah, it's a holistic approach.
Yeah. It's all. See, sometimes cupping works, sometimes a myofascial release will work, sometimes a trigger point release will work, sometimes a thing. So it's about identifying which is best suited at that particular. So it's purely subjective. That's the whole thing about it.
And one person was giving a feedback. One patient, he was saying the time that he will get into these kind of injuries, especially in the neck and the back, when he's performing some sports activities, every time he has a like jaladosham or nirkattu or somewhere he feels that he's getting puffed up in his face, there's more mucus formation. At that point of time, if he gets into any intensive sports activities, the possibility of catching some injury with these trigger points are very high.
Very high, yes.
So he has to live a lifestyle where these kapha, wherever the kapha is going to increase, he has to minimize it. I think when you are exposed to fan or air condition for a long time, or when you switch from very hot to a cold climate, and then suddenly your nirkattu or shobha has increased, that's the time on top of that, when you do an intensive activity, this trigger point gets activated.
Yes. So sometimes, it can also be, it need not be a trigger point in the muscle as such. It could also be a facial adhesions, that you can say. It could be related to a myofascia. Because the Shobham, it works on that facial level, and you're actually giving congestion or stiffness in that fascia, which actually kind of gives you a feeling it's coming to a trigger point. Because now there also a study being like how trigger points can be formed in fascia as well, not just the muscle, right? So I think when people are what do you say, exposed already with a kapha, a pradhana persons, or with that already there, and yes, definitely I think it's the fascia is being affected more than the muscle as such. So yes, it is correct, because that it plays along, like how I showed him that the myofascial meridian, how importance of the murda thaila is all, where we can actually ascertain our belief in that.
And even some people say when they apply oil, they catch that pain.
Yeah, that's what. So that's how. What do you say? Well proven Murda Thaila is that. Sometimes it's very strange that people don't believe it, or at least as doctors, it's very tough for us, because it is a very purely subjective, and you need a lot of experience to actually prescribe that best effective Moderator to every individual. That's something that we have to all learn
and I think Nasyam plays a very important role as a prevention.
Yes, Nasyam, Karnapurna, all that is very effective, because it kind of does that lymphatic drainage of this whole area.
Exactly.
It kind of relieves or adhesions, it relieves a stagnation in this fascia, and we call it scalp edema, something that we've talked about. Now, I think Rati Madam always talks about that importance of treating it, and so it is that, yes, definitely, Nasyam, Karnapurna, all that has a lot of, and even Rasnadi Churna application is
very powerful. Yes.
Yeah, very powerful in this.
Doctor, we have Dr. Srivat sir. He has raised his hand. Srivat sir, are you there?
Yeah. Good afternoon.
Thank you so much, sir, for being part of this. It's an honor for us that you come and give your comments.
Dr. Vignesh and Dr. Sreejit, I am just very, very happy to again hear Dr. Shine Mohan, who translates what he can practically demonstrate what he has achieved in his clinic also. So, Dr. Sreejit, I was just trying to relate when I was going through the textbooks also. Many times we have a difficulty of where to put in this cupping in our context. Dr. Sreejit, are you there?
Yes, sir. Yes, sir.
Yeah. So then while going through, again, teaching gives me a chance of going through these. So in Shalya Aharana Vidhi, there is the 33rd, 34th quotation is there. Dushta vada vishastanya rakta toyadi chushanaihi. This chushanam is actually, we know that it is aspiration. We can aspirate out something which is there as a shalya or a foreign body in one place. But there is another situation that you have a context where alabu, gadi, yantras are used in rakta visravana, in kabaja dushti. And you have in gunma also, this gunma apanayana through the gadi yantra. So this actually, we have a real situation where this cupping, whether it is a dry cupping or a wet cupping, where as Dr. Shine told, maybe that situation from a very difficult position, the Vayu is removed to another place where it annuls all the symptoms. So we have the references, and many times because we are searching where to relate the modern advancements with our own science. In fibromyalgia and other places in triggers also, I feel that there is a situation where we have a situation. I have seen that people will tell that if I press my hand, I will burp, or wherever there is pain, if it is pressed, tenderness will not be there much, but there will be a burp and there is a release of the symptom also. As you told, it may be subjective also, but we know that there is a wonderful array of play going on of the subtle vata in that. So here in the sloka, it is interesting that it is dushta vada vishastanya rakta toyadi chushnaihi. So in our situation where there is a influence of the vata being displaced from where it is causing the pain. That may be the thing which is happening in these dry cupping, etc. Of course, when rakta is involved, you are bound to remove it by wet cupping like rakta visravana. So the context of Ghati Prayoga in Gunma, as well as the Alabu and Ghati Yantras in Rakta Visravana, it is interesting. And I have seen this, as Dr. Shine told, with my master in acupuncture. He used to, whenever somebody comes with tympani, bloated abdomen, he used to do a moksha and a simple moksha in the umbilical region, and you know that the relief is fantastic. So maybe it's a reaffirming of these things. I was just trying to put in wherever we will be able to link up these things. And Dr. Shine, congratulations again. We did not meet in person, but I am always interacting.
Yes, sir. It's an honor again, sir. I think you also had attended the earlier thing on osteopathy, and also I remember the personal message you said. So it's really great honor, sir, because senior doctors and practitioners like you are also doing all these things, and it's a very encouraging for all of us. Thank you so much for your presence.
We have to do it so that we link up with I always tell that now if you are coming up with the page and your experience, that is great, and Dr. Sreejit is already doing it. Maybe we are out of the age for that, but still see that when you go through this osteopathy or any other biomechanical methods or any other manipulative methods, we have so much of McKenzie's methods, and you know that the author or the founder is mentioned over there, but who has practiced it, but we don't have. As you told, the immense strength of our calories and the people who are doing it, if we take into account, as Dr. Sreejit is doing the documentation, I think we can come out with the specific methods and which are applied on specific conditions in specific avasthas. So that is a great thing. Continue doing it. Wish you all the best.
Thank you.
Thank you, sir. So there is one for knee pain. Can we do cupping, Dr. Lakshmi Mutiala? Mutiala, yes.
One question was
cupping for knee pain?
When is before that, when is your next online course? If you could declare that, and then Dr. Pal Khandelwal.
Nothing in plan as such, as definitely. Yes.
But I think the simple mechanism is to look into your Facebook. No, you will make an alert anyway.
Yes. You can just like my page and you can get
my. Doctor, it would be good if you can type your page in that chat box so everyone can get it.
Yeah.
And also your
and
Facebook
moreover, Dr.
page.
Shan, we will be spreading the information anyway, so I think it will reach somewhere effectively. So about the knee pain was the question about.
Yes, doctor, definitely. Now, like I said, the important is trying to identify the reason of the knee pain, right? So if it's related to degeneration, if it's related to, I would say most of the conditions or the knee pain that we see in our clinics are related to soft tissue or muscle related or shoulder that we've been talking about, right? So in conditions like that, yes, definitely cupping is very helpful. So what I try to do with cupping is I try to release the muscles that are, connecting the knee joint. Now that's the basic thing I would do for every joint, right? I would see what best therapy I can do to release the muscles that is supporting the knee. It could be your the quadriceps play a very important role, your hamstring play an important role, your gastrocnemius, your calf muscle play an important role in all this, knee joint pain. So we need to understand the entire biomechanics of that particular joint, and based on that, we need to address the issue. So yes, for cupping, cupping is very, very effective in knee joint as long as the reason for the knee joint is related to a soft tissue, right? If it's related to a capsule or if it's related to a ligament tear or something like that, then definitely cupping does not have. But you can also do cupping as an assistance to rehabilitation of a knee joint after, let's say, a surgery or an injury. You can all do cupping with that because you're easing the the soft tissue that is connecting to it, and then it will only speed up the rehabilitation.
Next is about infertility or gynec cases, if you have got into that.
I didn't get that question.
In infertility or gynecological issues, if cupping has been utilized.
I think I know a lot of practitioners are doing it, but I personally I've not got any result because, like I said, when you cupping definitely will help because there is a certain location or positions probably in the just below the abdomen, which actually, like I said just now, Srival's talked, Dr. Srival sir, he spoke about the vitiated vata being aspirated out. So if you can do it with and we know that the kind of kashayam that we give for infertility issues like Sukumaran, Saptasaram, all that, how effective it is, and cupping add-on will definitely help. I wouldn't say it wouldn't help, but I don't practice that much. Like cupping for infertility, I don't really practice much. But yes, I definitely will consider it when I get some cases with that.
Yes, looking at the questions, I think pretty, Dr. Vignesh, I think most are answered, or almost everything.
Yes, I think we managed. There is a treatment for drooping of shoulder joint due to tear or weakness of muscle due to sports injury or lifting heavy weights. Dr. Shan, do you think?
Yes, I'm sorry.
Drooping of shoulder joint. Treatment for drooping of shoulder joint due to tear or weakness of muscles. It's by Dr. Hemalata GS.
Okay, so if again, I mean, is she asking is cupping effective in it, or is it
in general the treatment? Asking in general a treatment for drooping of shoulder joint. I think it's more of immobilization and.
Yeah, see, if it's post, a tear, then first you need to make sure that it is here. I know, since we don't have the history of the patient, I'm guessing that they have recovered from the tear and the muscle is in. And then I think it's about strengthening, right? Giving proper exercises, stretching, and improving the mobility of the joint. That's the basic thing about. And you give proper. First, you do passive stretches, and then once the patient if he's able to do passive stretches, then it is active stretches, then there's active stretches with weights, and that's how you proceed. That's like a proper physio rehab, along with medicines like, Brahma, you can add to it.
There's one question. How frequently should we do the cupping? I mean, frequently, not like how many times, but after we do one session, how much gap do you give before we do the second, in case if they need a few more sessions?
I think I would definitely wait for about 3 to 4 days.
Because, and then do the second
one. Because that's only if needed.
Okay.
See, again, with cupping, with all these techniques, like I said, we just stimulating the body's self-healing mechanism or self-regulation body. So we're just assisting the body. So there's so much of congestion, and then you just do a cupping session, and then you just wait for the body to process it,
recover,
and then you come and do it only if needed.
Okay, that's fantastic. Doctor, I think the Facebook page that you put, it didn't go to anyone. I think, can you go to that chat box and select everyone so that it goes to everyone? And I highly recommend everyone to watch his Facebook page. The content he puts is just fantastic. Okay. So, Doctor, just one thing that I would like to share. You were talking about the standing posture when people can droop their head forward.
Yeah.
There is one thing, I'm sure you must have heard about the Taylor brace, where you wear a belt. So I'll just share screen that. this is one thing I found when I recommend this to patients. If they're having a posture problem, you can buy this online with your size. And I recommend them to wear it for like half an hour or maybe like 15-20 minutes a day, so that they remind themselves that I have to correct my posture. You can all look into it. It's called tailor brace, because posture is a big factor when it comes to many of the pain that we see today. And then slowly we will wrap up today's session. And thank you, Dr. Shine. It was a very eye-opening session. And as you mentioned, we have to learn sciences from other allied departments also. Only then we will become a holistic aspect. And that holistic is so important. Otherwise, we just become so isolated. And this is the only way, like a frog in a little pond. Yes. So this ability to integrate, first of all, the foundation that we have in Ayurveda, and then when we integrate these with the pain management and the Shobhahara Chikitsa and the Lepam, and then when you do the Panchakarma, we are just giving a complete recovery for that person.
Yeah, and this I think whatever thing in osteopathy we should probably come in like a Purva Karma stage where you can actually do it with the massage, and the rehabilitation exercise part come in Paschat Karma. And it's about, yes, because there is a lot of updates being done. Even the physiotherapy courses, they're not so much into osteopathy. So osteopathy is something that is in the West that is booming, and hardly, I think only Sri University offers an MSc in osteopathy in India. So
that's true.
Even physiotherapists are not aware of it. Modern doctors are not aware of it. But since it is so subjective, it's the manual therapists or the physiotherapists who have found limitations and or reached a point where they've got stuck are actually exploring more and more about this, and they're coming with excellent methods and techniques and tools, and it's something that we all can really grasp very fast as Ayurvedic doctors. So I think that's what all these therapies, in the hands of an Ayurvedic doctor only will reach its maximum potential. That's what I feel. You cannot take out the Ayurveda-ness in ourselves, but that's a fact. You have limitations as other branches of science, as the medicine, how it works is completely different from what our methodology is. So this, and ours being a very subjective kind of science and the theories, so it is very important that we learn all these as well. And it has definitely helped me, and it has also helped a lot of doctors whom I've shared it with, and that's what keeps me going, actually.
Yeah, that feedback is that gives us that energy to keep continuing.
when you treat 10 patients probably, but when 100 doctors whom you teach and they treat 10, it's like it's 1,000. It's a completely different thing, and all are equally able to appreciate it, and that kind of gives you a more belief, and it actually stamps your thing in what you're exploring. So that's really helped me. So, and the process is on, continuous learning, of course.
I mean, I'm sure you would have seen a lot of patients who went to an orthopedic person, and then no result happened, and then they come to you, and then
I think it's not about boasting, doctor, because when after a BMS course, there is this second negative mindset that comes in, and we always know that as an Ayurvedic doctor, our biggest weakness is that we don't have painkillers. Right, that's what we that's what we believe in, or that's what we are taught, and that's what we are programmed. And then suddenly, and it's the same thing. So if a person comes, if he goes to an ortho doctor, and of course they'll be having a set of anti-inflammatory, painkillers and steroids, whatever it is. So as initial days of our practice, I didn't have the courage to actually tell the patients to stop taking those medicines. I would tell them, keep those painkillers, just in case you need it. That's how I started. That's how I was programmed. But then once I started applying these things, and I'm like, now I've reached a stage where I can confidently say that, see, you don't have to go for painkillers at all, because I've treated cases where people have had like 2 or 3 painkiller injections and they've not actually gotten rid of, and they came to me for one session. I've been able to do it. It's just the for painkiller injections are not very, very effective in musculoskeletal conditions. That's the thing that I kind of propagate. It's completely ineffective, because the for treating musculoskeletal conditions, you need to address the issue, and also you need to educate the patient. That education part is also very, very important. You don't just treat and go and just ask them to do whatever they have been doing. No, you don't. You correct the posture, you correct their routine, you correct their food habits, and then you educate them and tell them, see, if you do this, then you don't have to come back to me or any other doctor. If you don't do this, then you're going to keep changing doctors and go. That's it. And so people are like more aware, and I've always felt that patients are very intelligent sometimes. They say, yes, doctor, you're right, because I've noticed that if I have this or if I do this, yes, it increases. And now since I kind of say it, it's like an affirmation now. So they understand it and then they do it. So yes, I think I don't feel that we are weak anymore just because we don't have painkillers. We don't need it anymore. That's what I feel. Yes, of course, I'm not talking about any trauma or accident.
Exactly.
Yeah, I'm just talking about the musculoskeletal condition that we see in our clinic. Yeah, so I think I have to be very careful with choosing words.
No, actually, there is a saying. Actually, constraints make you more effective, because whatever we limit, we try to, like, a blind person has a better ear perception than a person who cannot see, because he can put more energy on how to hear, because his energy is not wasted in seeing.
Yeah.
Same way, not having a painkiller, we are able to focus more on the root cause. And there are reports which says, taking a painkiller is like turning off the fire alarm bell. The fire is not stopped, but just the alarm is stopped, but it's going to come back again with much more force.
And also something recently that I've learned is, before doing all this cupping or these sessions, to get a very good result, I think you advise the patient to stay away from painkillers at least about 3 to 4 hours before the session, because you don't get that proper feedback if somebody has a painkiller and then they come for a treatment, right? So I tell them that, please don't have anything. So we know the exact feedback of the body.
And that's what's happening when people take that painkiller. They get disconnected with their own feedback loop, then we are not able to give them the right approach. And as you always mention, when we identify that trigger point, and is this where the pain is, and they feel okay, suddenly they feel safe, that at least someone is able to give me what is the cause of this.
Even we learn, we have a sloka, darsana, sparsana, prasnehi, parishade, loge, and we talk about it everywhere, but how many of us do sparsana? That's why. And then when you have a patient, you do a sparsana, and this is what I've always felt, like they would have gone to n number of doctors and nobody even bothered to actually test the patient or touch the patient, right? And then when you do it and you find the exact spot, and they're like, okay, I'm not leaving him, and he's got that spot to do something to get me, help me get it off it. And that's what they said. And it's been a very good impact on, and I've had like patients referrals and all. And it's very interesting that in this present age that we're living in, like in not just the COVID and even muscular, even because throughout the COVID, during the pandemic, when everybody were closing down, and because ours is a private clinic, it was not possible for us because people were facing these issues, right? And they couldn't go to doctors, and it was very tough for me. But and thank God, because that has actually kept me going on, because yes, musculoskeletal conditions, and a lot of people are facing it. They come to us, we're able to give good results. So I think it's been very encouraging
and rewarding at the same time.
Yeah, rewarding. Yes, of course. I mean, we could imagine, what if I didn't know all this? Then it would be completely different. I still know. I was at one point of my career or starting my career, I didn't know all this. Definitely, I didn't know. I was like a proper programmed Ayurvedic doctor, and I would stick to the slokas and then hope for miracle to happen. Not always it happens, right?
But I think if you stick to that slokas, as you mentioned, the last sloka that you showed in your slides with Sushruta Samhita, we are supposed to go and learn other elite sciences and integrate it.
Yeah, that's what. I think Ayurveda is about all inclusiveness. Even the acharyas taught us to be, learn to have that attitude of inclusiveness. And suddenly you have these, hardcore people, coming at the cupping. How can an Ayurvedic doctor touch cupping? Like, okay. Good for you. If you don't do it. There's a lot of people who swear by it. I mean, I'm not. Yes, we have these different sectors of people here. We have hardcore samhitas, experts who can do it, and who can, give the pearls of wisdom from it to us. But then they how strongly shun certain habits that other people are doing. So I think in general, Ayurvedic doctors should have that broad-mindedness to actually include everything that is around. And
I think the best way to answer that is, at the end, our goal is to make sure the patient is going pain-free and disease-free.
As you prioritize the patient's need and shut away your egos, then yes, and I think Ayurveda can definitely go on there. Because I'm still, it's sad to say that, there's so much thing is happening, and I think the academy should step up, the policymakers should step up and try to get this done in colleges itself, because I can imagine, the kind of confidence and belief that I get when I treat a patient. And I can certainly wish that, what if I had the same feeling when I was doing my final year or when I was doing my internship, and I could watch such, miraculous results. And that would have been a completely different game changer, in my beginning. And it would be the same for all the students who are there. And there's so many students and so many colleges. And I think it's time to adapt and evolve, our syllabus, and try to, I think there should be one section that keeps on adding things every year, at least one subject, that's enough, just a subject which says, let's check what's happening in the world, and then you keep adding, and I'm sure every year you will have something new to add in that, but it's not being done. I think the syllabus, what it was 10 years back, it's the same thing now, and it's the I would say the whole luck and fate of the students, if they find some connections and are able to explore and they get introduced to such things. It's not so. I'm just imagining, in a session like this, nothing about 440 doctors registered, and we saw about 280 plus were able to online, and we're talking about 24,000 Ayurvedic doctors, others. So that's like a very, very, very minority that is actually even, and it's not just in Kerala. In Kerala, we have around 24,000 doctors alone. But you're talking about throughout India, from different states, we just got about 180 to 280 participants. And I think I'm glad that, anyway, it's a step. More people will join. Definitely, there is no way out. And in the end, everybody will start beginning to integrate, because I don't see any other option than to integrate and adopt these things, because it's going to be very tough for survival as well.
Actually, Dr. Shine, I don't mean to interrupt you, but our task is to do our dharma and karma, which we are doing constantly. As you know, we are in groups together. That this information of this webinar is going to 18 Ayurvedic colleges all over. I mean, so it's quite a lot also up to the learners to find the priority. So that is very important. And I think there is no point crying or being in an inferior complex of mind, inferiority of mind by about we don't have privileges, we don't have this and that. It's about taking up the responsibility of trying to learn. So once they learn, they can think of propagating, and then they can serve properly, and the process they can prosper. This is how I would always recommend that. So a lot depends upon the interest. Of course, we are creating interest. The same your class also, as you saw, I was sending you proof after proof that we did 5 rounds of conveying, propagating it. And I simply think, like 20 years ago, when I was a young doctor, starting as a young doctor 20 years ago, I haven't even heard, I'm ashamed of that, it's my fault, I haven't ever heard of cupping. But compared to that, today's kids, they have it through our groups, at least they know the word, and they know the opportunity and the place where they can learn. So we are putting everything in the plate for the younger generation.
Yeah, I mean, even you're talking about 20 years ago. 10 years ago, there was no Amazon or Flipkart,
Yeah.
And
yeah.
I couldn't buy a cupping set. And I was like, how do I do it? Because I learned it, I'm exploring it online. So I got I checked up, there was some company in Bombay selling, and they were doing only minimum order of 1,000 cupping sets. So I had to, message my brother in Dubai, and I asked him to see if he have, and so he explored the Chinese market there, and I got my first cupping set. It was not per se an imported set, but it's just that was the only thing available. I had to go all the way to Dubai to get my first set. Now it's changed. You go to Amazon, I said, and there are also dealers in Kerala whom I will share the numbers with. See, you can contact them. It's a completely different thing now. So yes.
But anyway, the very fact that we are together today discussing this, even after late afternoon, it is nearly 1:30, is a big sign of progress. And Sitaram institutions are doing that great work where they are trying to empower the patient's welfare through empowering the doctors' capacity of learning and practicality of it. So I think the times are better than what we had 20 years ago.
Definitely, and with the kind of connectivity that we have, internet, we can definitely see. We are like I said, even though we're talking about less number, but I think reaching to about 280 participants, all these at the same time itself is a great.
Yes.
Yeah, so it's
anyway,
really,
these recordings will be going to them, so no, it will always spread only.
But I think, Dr. Shine, we have to, now that world is opening up, we need to do a offline course on cupping to a lot of people. I think this can save a lot of patients money and their, the time they will waste when they fall sick with pain, the hospital, they fall for work sick, they can't, their relationship is affected. In fact, there was a question about infertility and cupping. And I think because once you do cupping and the pain is relieved, they will have much better calmness, because anxiety can lead to issues with fertility.
it kind of ignites.
Exactly.
There is this.
I don't
okay,
know
what I'm saying is, like, all these kind of massage therapies and this stimulus of touch, it has so much effect on a lot of endorphins being secreted. How it calms the mind and body. There's a lot of different aspect to it that we need to really address. And there is lots that we can do, and that is exactly we had been doing without knowing it. Like, say, in a marma therapy, or let's say in a marma massage, or let's say how the marma massage, by looking at it, it's not impressive at all, but when you keep practicing it and when you see the result it has on the patient, that's how you understand, like, how these important these interconnections in the body are. And then you have these chakras. Now, I didn't want to bring in chakra because, again, you talk about osteopathy, you talk about the alignment of the system. Ideally, you're also bringing a proper balance to the chakra as well. If you could include that philosophy as well, that's what how an issue in the ankle can actually disturb the chakras, because your body is not misaligned. And that's how you can actually connect, because energy level, yes, there are a lot of philosophies and things that we can add on, but ideally, let's stick to the basic. Let's see, start exploring it from a physical view, and then you can explore the other aspect. That's the whole thing.
Okay, thank you, Dr. Shine and Dr. Sreejit. And I think we will have a roundup. Anything to be added, Dr. Sreejit, sir?
Okay, I think I just
all perfect.
If I could just ask the one question. There was
yes.
somebody. I had a few cupping sessions for adhesive capsulitis. Can't say I felt any difference to pain and range of motion integrated with Ayurvedic protocols. Again, I think since you got that diagnosis absolutely right, I would actually tell you that cupping has no effect on adhesive capsulitis, because it's a capsule related thing, let's face it, and we need to do proper things, snehana and so on, like whatever we have in the classic Ayurvedic reference you can do. You can do cupping to relieve the spasm or the stiffness in the muscles that are surrounding the shoulder joint. Only on that aspect you can do cupping. Never do cupping for adhesive capsulitis. I think it's a wrong thing completely. So glad that you pointed out, and this is where you have to find the difference. Now, I wouldn't suggest all these techniques are the answers for every problems that you have, but these techniques will definitely help you in an area where you will find where you'll find a blockade. That's the whole thing that I was trying to put in.
Thank you, Dr.
More like accelerators. Let us carry back home the message. These are not end game by any ways, but they're like accelerators and augmenters, making things easier and faster.
We need to give due respect to everything. You don't swear by one thing over the other. Then again, you become very narrow-minded. So that's not the intention.
Absolutely fine.
Okay.
Thank you very much.
Thank you so much, Doctor, for so much of Sreejit SP sir has been sharing in so many groups, and I can't thank you enough for really being such an encouraging so much. So thank you so much, Sitaram. Thank you so much, Vignesh, Doctor, and you've been setting out the whole the session.
Thank you all, everyone, and thank you, Dr. Shine, and see you all next Sunday, 10:30. Thank you all.
Yeah, bye. Stay.